The, co- the Committee of Finance is on the record. Madam Clerk, can I have a roll call, please?
Senator Marvin A. Blyden.
Please mark Senator Blyden as tardy.
Senator Blyden, tardy. Senator Samuel Carrion. Senator Carrion, present. Senator Dwayne M. DeGraff. Senator DeGraff, absent. Senator Donna A. Fred Gregory. Senator Fred Gregory, absent. Senator Javon E. James Sr. Senator James Sr., present. Senator Janelle K. Sarow. Senator Sarow, absent. Senator Kurt A. Vialet.
Here.
Senator Vialet, present. Mr. Chair, you have 3 present, 3 absent, 1 tardy.
Senator Donna Fred Gregory, please mark as present.
Mr. Chair, you have 4 present, 2 absent, 1 tardy.
I just got that Senator DeGraff will be on Teams, so place him as present.
5 present, 1 absent, 1 tardy.
Any correspondence, Madam Chair? Madam Clerk?
Yes, Mr. Chair.
You may proceed.
Correspondence dated June 30th, 2021. The Honorable Kurt A. Vialet, 34th Legislature of the Virgin Islands, Capitol Building, P.O. Box 1690, St. Thomas, Virgin Islands, 00804. Dear Senator Vialet, this letter serves to inform you that due to a previously scheduled off-island engagement, I will be absent from today's Committee on Finance meeting. Please accept this letter on my behalf for an excused absence and forward any relevant information to my office. Also, please accept my best wishes for a productive meeting. Respectfully submitted, Janelle K. Sarow.
Please mark Senator Sarow as excused.
Mr. Chair, you have 5 present, 1 tardy, 1 excused.
Thank you, Madam Clerk. You may proceed with reading the agenda into the record.
The Committee on Finance for Fiscal Year 2022 Budget Hearing, Wednesday, June 30th, 2021, in the Fritz E. Lawetz Legislative Chambers, Christiansted, St. Croix, U.S. Virgin Islands. The Committee on Finance will receive testimony on the proposed fiscal year 2022 executive budget for the government of the Virgin Islands of the United States. At 9 a.m., the Governor Juan F. Louis Hospital invited testifiers Daima Williams, Interim Chief Executive Officer. And at 1 p.m., Frederiksted Health Care, Inc. invited testifiers Masseray Sproul Webster, Chief Executive Officer. Mr. Chair, this concludes the reading of today's agenda.
Thank you, Madam Clerk. Good morning to the people of the Virgin Islands. Good morning, colleagues. Good morning to the testifiers. Today, Wednesday, June 30th, we'll have members from the Governor Juan F. Louis Hospital testifying before us, and later this afternoon, we'll have the Frederiksted Healthcare Center. At this time, I'm going to allow the interim CEO to place her name on the record along with her team, the members who are here in the well, and those members who will be testifying virtually. So beginning with yourself, Ms. Williams. 1 minute.
Williams.
Start again.
Daima Williams,
Okay.
ICO for JFL Hospital and Medical Center.
Thank you. We'll proceed to your CFO.
Good morning, everyone. Chanel Marie Moorhead, Acting Chief Financial Officer of JFL.
HR.
Good morning, everyone. Terry Lynch, Acting Chief of Human Resources, Juan Louis Hospital.
Council. Counsel.
Good, good morning, everyone. Siobhan Thomas, Legal Counsel.
CNO.
There's me? Oh.
No. Let's speak out loud.
Everyone, Valerie Lee, Chief Nursing Officer, JFL.
Mrs. Smalls.
Good morning, Darrell Smalls, Executive Director, Territorial Redevelopment Team.
Next.
Good morning, Hazel Filbert, Chief Operations Officer.
Anyone else?
Go again.
Who's YT?
Good
Okay.
morning, Ron Thomas, Project Management.
Say it again, Ms. Thomas. Ms. Thomas, can you repeat so it could be clear on the record?
Yvonne Thomas, Project Management, JFL.
Can I think we have one more?
Senator, good morning again. Present with us here today is Chief Information Officer, Mr. Gregory Bryant.
Okay. And that's it for virtual?
Yes, sir.
Okay, thank you so much. You may proceed with your presentation. And you're going to have media is going to do a presentation throughout your presentation? Or?
Yes, sir.
Okay, that's fine. You may proceed.
Thank you. Good morning, Honorable Senator Kurt Viele, Chairman of the Committee on Finance, Honorable Finance Committee members, other senators of the 34th Legislature of the U.S. Virgin Islands present, and the listening and viewing audience. My name is Daima Williams, and I am the Interim Chief Executive Officer of the Governor Juan F. Louis Hospital and Medical Center. It is a privilege to be here with you today to present JFL's Fiscal Year 2022 budget request. To assist me with this presentation today is the Acting Chief Financial Officer, Chanel Moorhead, and the Acting Chief of Human Resources, Terry Lynch, in person. And virtually, we have the Chief Operating Officer, Ms. Hazel Filbert, Chief Legal Counsel, Siobhan Thomas, Chief Nursing Officer, Valerie Lee, Chief Information Officer, Gregory Bryant, who is also here present with us today, JFL Project Manager, Yvonne Thomas, and the Executive Director of the Hospital Redevelopment Team, Mr. Darrell Smalls. I have organized my testimony into 4 key areas. 1, key accomplishments. 2, priorities for FY 2022. 3, JFL's financial position and specific budgetary request. And 4, JFL's recovery. Key accomplishments. JFL is on a trajectory for tremendous growth and transition. Despite ongoing disaster recovery projects, current JFL infrastructure instability, and managing the COVID global pandemic, we have made significant strides. ICU renovation. On March 13th, 2020, we celebrated the reopening of JFL's newly refurbished 12-room ICU intensive care unit, which can, in the event of an influx of COVID-19 patients, be turned into an isolation ward. As a result of this proactive decision to refurbish the ICU, we have been able to successfully manage COVID-19 patients from the peak of the pandemic to the present. One of the highlighted features of the ICU is the installation of the innovative Lumilaire ultraviolet and disinfectant light systems that targets and eliminates the spread of airborne pathogens, including mold, bacteria, and viruses, even COVID-19. We are thankful that we were able to complete this unit at the start of the COVID-19 pandemic, as these new lighting systems and precautions in the ICU have served to protect our valued staff from plausible exposure. In addition to our refurbished ICU unit, we have also successfully expanded JFL's internal COVID-19 surge capacity by remodeling a clinical care unit to add an additional 14 double occupancy rooms to the facility's bed count. There are also 18 to 20 stretchers reserved in the former cafeteria space in JFL. Kudos to our JFL team members and providers for their hard work and dedication during this unprecedented time. Service line expansion. You may recall from last year's testimony that we were able to expand our operating room department from 1 operating room to 3 operating rooms. We were then able to introduce our total joint replacement GPS program. JFL successfully launched this state-of-the-art total joint program in August of 2020. We are pleased to share that we were the first in the territory to initiate the state-of-the-art total hip, knee, and shoulder joint replacement program with an exclusive contract for GPS navigation technology, which enhances the accuracy of the surgical procedure. This allows for critical on-island surgical intervention for our community, as well as increase in much-needed revenue, and a decrease in patients flying off-island for care. To date, we have completed 30 successful procedures. For us, success means that patients are discharged between 23 and 48 hours after surgery, including post-op recovery, and that the patient and their doctor report that they are healing well. Success also means that the nursing team, the physicians, and the billing and medical records team ensure proper documentation and complete, accurate charge capture to maximize our reimbursements. Of the 24 cases that have completed the billing process, the cost to JFL for performing these surgeries is $261,000 versus a total collections of $466,000, which represents a profit of approximately $207,000 for 24 procedures. 6 of the procedures are currently in the reimbursement process. We look forward to the completion of more procedures and successful outcomes for our community, as well as other revenue-generating expansion opportunities for JFL. We have also initiated 5 minimally invasive gynecological interventions that will provide laparoscopic procedures for women's health services. We continue to work on further expansion of other surgical lines of service. Clinical line expansion. Since last year's budget testimony, we have engaged a vascular surgeon to provide dialysis vascular access. This surgeon has provided much-needed dialysis access to our patients and has therefore decreased the need for patients to leave island for this life-saving vascular access and treatment. The vascular surgeon has also contributed to expanding our clinical lines of service by providing vascular and surgical trauma intervention, resulting in a decrease in off-island transfers. We have also contracted with an additional anesthesiologist slated to commence engagement in August of 2021, which further allows for expansion of our operating rooms anesthesia coverage for all surgical services. Workforce development. This year, we celebrated the 2nd graduating class of JFL Peace Officers. JFL Peace Officers have been instrumental in reducing threats internal and external to JFL, despite ever-increasing gun violence in the community. We are proud of this ever-growing program, the collaboration with the Virgin Islands Police Department, and 5 officers who have been able to participate in this workforce development initiative. In June 2021, we commenced our internal surgical and central sterile technology program, designed to provide CMAs, CNAs, LPNs, and technicians with the skills necessary to prepare operating rooms, surgical supplies, instrumentation, application of aseptic techniques, sterilization procedures, and all skills necessary to advance their careers. This workforce development program will serve to provide on-site training and meet our expanding operating room needs. As we continue to grow our operating rooms, our goal is to ensure that all employees have the ability to perform their best work at JFL. We utilize training opportunities to create growth for our existing employees. Examples of such training in 2021 include training on COVID-19, clinical care strategies, life support, cardiovascular training, financial literacy, employee wellness, customer service training, leadership in nursing, diabetic ketoacidosis, crisis prevention training, and training on the use of new infusion pumps in our ICU. Our desire is to offer hands-on, off-island training opportunities and certification opportunities for our critical care staff in the future. Future forward, JFL's 2020 priorities. Below, we provide a summary of JFL's priorities. Meditech Expanse upgrade, which is JFL's electronic health record system. We are in the process of initiating a major IT systems upgrade, as JFL's current version of Meditech is 10 years and 7 versions behind. The ability to interconnect with external agencies for meaningful use compliance and exchange of patient information using these innovations in IT systems is increasingly integral to our overall success and solvency. The total cost for this upgrade is $6.1 million. However, this upgrade will allow for the following: efficient charge capturing to increase revenues, remote physician access for documentation and order entry, streamlining of our processes, and improvement in the quality of patient care by utilizing data to achieve quality care goals. We are seeking all funding opportunities for the completion of this upgrade. Restoration of lines of service. In addition to service lines restoration and expansion mentioned in this testimony, we continue to research other clinical opportunities upon completion of performance showing consistent revenue determination. We also look forward to increasing the quality of behavioral health interventional services with the opening of 4-bed inpatient unit once we move to JFL North. Decrease of off-island patient transfers. Despite the COVID-19 pandemic, we are projecting that we will be able to decrease off-island transfers by approximately 25%. For this current fiscal year, we continue to trend downward on off-island transfers. Our team's dedication to reducing the millions of healthcare dollars leaving the island of St. Croix and the separation of patients from their families when they are most vulnerable and in need of family support remains our primary focus. Workforce development. Hospitals are not just doctors and nurses. We are a small city with 24 hours, 7-day-a-week operations. As such, we need the wealth of resources of a small city to sustain our needs. Recruiting essential employees to run the operations for JFL has been challenging. There has been significant licensed, certified talent that has relocated away from the territory in search of more competitive opportunities. Competitive salaries offered on the mainland, coupled with the high cost of government employees' retirement systems, the cost of living, and affordable housing availability make recruiting and retention of JFL team members very difficult. Pursuit of Joint Commission status. JFL is committed to maintaining Centers for Medicare and Medicaid Services certification and pursuit of Joint Commission accreditation. Community engagement. JFL is the community's hospital, and we want our stakeholders to share with this executive team how JFL can improve their well-being and best meet their healthcare needs. FLAD, our architectural and engineering firm for the new hospital build, anticipates hosting stakeholder engagement workshops with our community partners to learn their perspective regarding their needs for acute and outpatient services. New revenue streams. For fiscal year 2022, we are embarking on 3 new revenue streams to bridge the gap between our revenues and our expenses. We have identified these opportunities as a team, and we look forward to buy-in from all our stakeholders. Telehealth. Telehealth is the future of access to healthcare across the globe. The use of telehealth became even more prolific during the pandemic, as those facilities that had already embraced telehealth were able to seamlessly launch their platforms and remain connected to the community and improve access. JFL has recently onboarded a Chief Information Officer, a CIO, who is one of the key elements to the success of this initiative. JFL plans to create a virtual visit platform, our primary initiative, as well as create an online patient portal which will allow patients remote access to their medical records and payment of their bills online. Like many other hospitals across the nation, JFL is plagued with long emergency department wait times. This has an immediate effect on patient experience, which influences our revenues. During fiscal year 2019, 11.4% of our patients coming through our emergency department left without being seen. That represents a loss of 11.4% or $1.3 million in potential revenue. To try to capture that revenue, implementation of our virtual visit platform will allow patients with a lower level of acuity to be evaluated remotely. Patients can be triaged virtually and even evaluated by a physician, who can then give proper advice, which may include physically coming into the emergency department. If that is not needed, the physician can electronically send a prescription to the patient's pharmacy of choice, and the patient can have peace of mind without ever stepping foot in our emergency department. If the patient does need to come in, they can pre-register and even be given an approximate time they will be put in a bed, which will limit the overall wait times in the emergency department waiting area. CMS has provided guidance on how JFL can bill and appropriately be paid for these virtual visits. Our CIO has also identified a grant offered by the CARES Act, which is specifically for hospitals implementing telehealth. Our application is in the final review process. Primary Health Wellness Program. JFL is exploring the possibility of offering a primary health wellness program. This outpatient program will expand our services and increase volume in our accredited laboratory and radiology department by extending the hours of these departments by an additional 3 hours per weekday and some hours on the weekend. This will open up departments to patients with traditional daytime work schedules by increasing the hours of those departments. We believe we can see potential increase in revenue of 38% or $6.9 million. Reinvigorating the Virgin Islands Cardiac Center. With the funding appropriated by the 33rd legislature, JFL was able to pay the balance for over $800,000 owed to the vendor that supplied cardiac care supplies. In addition, JFL was able to relocate the medical surgical unit, which was housed in the VICC from 2017 to April of 2021, back into the main JFL building, thereby freeing up VICC for renovations and reconstruction of the Virgin Islands Cardiac Center. With this, JFL is poised to be able to move forward with the reinvigoration of interventional cardiology in the near future. When analyzing past VICC revenues, JFL made over $10 million in FY 2016. If JFL can achieve just half of that during FY 2020, we can realize potential revenues of over $5 million. We do realize that these opportunities require a push on the marketing front. JFL plans to increase the marketing of all of our revenue-generating services to ensure that our community is aware of JFL's complete line of medical services. We are budgeting $150,000 for FY 2022 to allow us to pursue and ensure the payment of an all-around marketing firm. In the interim, we have two screenshots of JFL's new website. We anticipate launching our new website by August 2021. JFL's financial position and budgetary request. Expenses. JFL's payables balance decreased from $35.1 million at the time of last year's budget hearing to $33.8 million as of the end of May 2021. This represents a decrease of $1.3 million or 3.7%. This is during the COVID pandemic, where hospitals across the nation, including JFL, experienced a significant decrease in forecasted revenues. We continue to prioritize keeping our current expenses paid, while at the same time paying over $270,000 per month in past due balances owed to vendors from 2015 and earlier. This represents over $3.2 million in payments to past due balances owed for the year. It is unfortunate that we inherited a financial situation where vendors were unpaid from 2012 to 2015, despite the revenues generated with high patient volumes during these years. Most notably, the GERS and Internal Revenue Bureau debts that were unpaid for several years. This failure to pay GERS and IRB resulted in increased interest debt owed by the hospital to these agencies. We take calls from our retired employees every day and feel their pain, as we know the many years of dedication they gave to JFL and this community. We have worked with GRS to reduce this amount owed by approximately 38.1% during our tenure. Included in your testimony package is a report showing our expenses through May and forecasted out to the end of the current fiscal year. Our budgeted expenses for FY 2021 were $83.8 million, and we are forecasting to the end of the year with expenses of $76.6 million, which represents $7.2 million or 9.1% reduction in expenses. This is due to proper financial planning, more efficient procurement processes, ensuring JFL is getting the best price for every equipment supply purchased, better inventory controls, and the pushback of the expected expenses involved in moving to JFL North to FY 2022. We have streamlined and audited payroll, petty cash, payables, and procurement processes, including cross-training and combining departments to save over $100,000 in related salaries. As we continue to operate in post-Hurricane Maria JFL main building, as discussed in previous testimonies, the physical infrastructure serves as a rate-limiting factor in expanding and stabilizing services. This year, we have experienced several challenges with our critical utility and mechanical systems and continue to work to mitigate these challenges. Currently, JFL has $1.4 million of funding held at the PFA that was appropriated specifically for capital improvements. JFL plans to use that funding to assist with the necessary repairs needed for the current building to ensure our staff and patients are comfortable until the transition into JFL North. Revenues. Our budgeted revenues for FY 2021 were $65 million, and we are forecasting that we will end the year with revenues of $68.7 million, which represents a potential increase in revenues over budget of $3.6 million. This is an increase despite the pandemic and the loss of potential revenues from not moving into JFL North during this fiscal year. We expect to see even more revenues realized in the coming fiscal year. Included in your testimony package is a report showing our revenues through May and forecasted out to the end of the current fiscal year. A focus on billing. JFL implemented and continues to undergo a revenue cycle audit to address any deficiencies within our billing process. This audit looks at the credentialing of our physicians, both locums and staff, to ensure that every physician performing services within our walls have all the proper necessary documentation to allow for complete and accurate billing. Additionally, there is an ongoing pricing structure update by local certified charge master, in which we closely follow industry pricing standards. Earlier this year, we also had a team member train and successfully pass the exam to also become a certified revenue integrity professional. We also have a full-time certified coder who successfully completed their ICD-10 training last fiscal year and closely monitors our off-site coding company. This initiative allows for efficient charge capturing and timely coding. With the implementation of our off-site billing company in April 2019, our in-house billers have been able to focus on self-pay balances as well as appeals for any claims that are past timely filing. This has allowed our internal billing team to generate $5.2 million in previously unrealized revenue. Much focus during this past fiscal year has been placed with our revenue cycle team to include successfully offering training to members interested in upskilling, reinvigoration of our revenue cycle committee, and the recent hiring of an experienced local auditor who is responsible for analyzing every aspect of our revenue cycle and presenting areas for improvement and efficiency. We are happy to share that JFL has already begun the process necessary to bring our billing process back in-house. Our team members are enthusiastic and ready to bring this process back within our JFL walls. One takeaway from last year's budget hearing was that we need to come up with benchmarks to measure the performing of our billing. One such measure implemented involved analyzing past performance and using that as a benchmark for process improvement and optimization of current performance. For past performance, it was important for us to use fiscal year 2017 as it is the most recent year not affected by hurricanes and/or the pandemic. Finally, we are happy to report that so far, for the current fiscal year of 2021, we continued focus on revenue improvement. We have exceeded our benchmarks with an increase of 35% monthly average cash collections of $3.4 million based off of net billed of $9.8 million. What makes this even more of an achievement is that we are able to exceed this benchmark with significantly lower patient volume due to the damage of the hurricanes and the current pandemic, with our current payer mix being 75% Medicare, Medicaid, and self-pay. For the future, we will focus on net collection rate as one of the major key performance indicators, which is used by hospitals nationwide to measure the effectiveness of hospital collections. The net collection rate is calculated as net payments divided by net charges. According to industry standard, the rate should be between 95 to 99%. Currently, through April 2020, our rate is at 90%. With our continued auditing of our revenue cycle process, we plan to increase this number by 5% to meet the national standard, which would thereby increase revenues by $2 million. Interagency debt. JFL continues to be burdened by interagency debt. The total owed by government agencies for services provided by JFL is over $12.1 million. The agency with the largest balance is the Bureau of Corrections with a balance owed of $5.2 million. Recently, thanks to Bill number 34-0024 and the collaboration with the Virgin Islands Department of Labor Workmen's Compensation Division, JFL was able to confer with the Department of Labor to resolve a portion of the labor's debt to JFL. We provide a PowerPoint slide providing for the amounts owed by other agencies to JFL. Project worksheets. For our FEMA-funded recovery projects, JFL has a total of 24 project worksheets, of which 21 have been obligated in terms of funding. The remaining 3 project worksheets are pending obligation. A total of $76.3 million has been spent to date on PW projects, with $75.1 million already reimbursed to JFL. The remaining $1.1 million is pending reimbursements, and they are in varying stages of the process. Most of the PWs are 90% federally funded and require a 10% local match. JFL has sought assistance from the Community Disaster Block Grant Disaster Recovery for this 10% match. So far, 2 draws have been completed by CDBG for a total of $4.3 million. We are thankful to FEMA and our local partners for ensuring these funding opportunities for JFL's recovery. For our COVID-19 related expenses, JFL has received a total of $11.8 million to date from the CARES Act funding, $3.1 million of which was received in this current fiscal year. Of the $11.8 million received, $5.6 million came directly from the U.S. Department of Health and Human Services, while the remaining $6.1 million came from the local treasury funds administered by the Office of Management and Budget. This is in addition to 2 obligated COVID-19 PWs to assist with expenses and forced account labor. We are thankful for this funding and the national and local recognition that hospitals nationwide were closing due to a failure to meet their financial obligations. To date, 30 hospitals have closed nationwide since the inception of the COVID-19 pandemic. We have also received many donations from community and are grateful for their heartfelt support. Total donations range from the Department of Health to the In the Mix to Plaza West to Home Depot and more. The total value of the donations JFL has received since the beginning of the pandemic is estimated to be $338,000. This value is important because we can use it to offset the 25% local match required for the COVID-19 PWs. We also thank Tim Duncan for his donation of an oxygen generator. His generous gift is in honor of his mother, Delisa Ione Duncan, who worked as a midwife at JFL prior to her passing. We are honored that he chose JFL. His generous donation has helped assure us that every patient that enters the doors of the new JFL North has life-sustaining oxygen made right here on the JFL campus. Audits. We celebrated successful completion of our audit of fiscal year 2019 with an unqualified opinion and are underway to completing our audit of fiscal year 2020. An unqualified opinion represents a thorough audit of a firm's internal systems of control and its financial statements and all supporting documents, and that the financial statements are presented fairly and appropriately. JFL's specific budgetary request. JFL is projecting a total expense for FY 2022 of $87.3 million versus a total revenues of $70.5 million. This will result in a budget shortfall of $16.7 million. It is important to note that this deficit includes the appropriation from the Virgin Islands government. In order to bridge the gap, JFL has begun the process of many revenue-generating prospects to include the 4 major opportunities mentioned before that could help JFL realize an additional $15.4 million in FY22, bringing total revenues that year to $85.9 million, representing a $1.3 million deficit. The budgeted expenses for FY 2022 assumes an increase over FY 2021, projected expenses of 40% for personnel and fringe benefits. Supplies increased by 10%. Other services and charges increased by an average of 5%, and utilities increased by an average of 25%. This increase assumes the increased expense overall due to the hiring of necessary clinical and non-clinical staff and the purchase of additional supplies and equipment for the projected increase in volumes of JFL North. The budgeted revenues for FY 2022 represents an average of 20% increase of FY 2021. Projected revenues assuming the opening of JFL North, which will allow JFL to offer more revenue-generating services. HR 3434, the Territories Health Equity Act of 2021. As recently as May of 2021, Delegate Stacey Plaskett introduced to Congress HR 3434, the Territories Health Equity Act, which would provide a long-term solution to the upcoming 2021 fiscal cliff in Medicaid programs, eliminate healthcare disparities in U.S. territories faced under federal health programs, eliminate the funding cap on Medicaid reimbursements, eliminate the share between the federal and local match, eliminate the exclusions from participating low-income subsidies in Medicaid, Medicare prescription drug programs, improve Medicare reimbursements, eliminate the exclusion from disproportionate share hospital programs participation under Medicaid and Medicare, which currently increases uncompensated care costs to the Virgin Islands government. Allow residents of the U.S. territories who are unable to obtain health insurance through their employer or a health insurance exchange to instead access the marketplace insurance coverage that is also available to members of Congress and congressional staff. It will also ensure that Virgin Islanders are equitable and receive health benefits that are on par with their stateside counterparts as equally American citizens. One of the major benefits of this act is the chance to significantly reduce or eliminate uncompensated care costs, thereby allowing JFL to support the business side of healthcare and remain economically solvent without a need to depend on allotments from the Virgin Islands government to meet our basic financial obligations. JFL's financial reality is that a significant portion of the patients we see every day are either uninsured or underinsured, resulting in large amounts of uncompensated care. As defined in Title 19, Section 2021 of the Virgin Islands Code, as the sum of charity care and bad debt resulting from healthcare services provided by the corporation after due diligence to collect. For the current fiscal year through May of 2021, Medicaid and Medicare patients represent 72% of our payer mix. If we add self-pay, that percent increases to 75%. In other words, only 25% of our discharged patients have commercial health insurance. Section 240 of Title 19 of the Virgin Island Code provides that payments for the general revenues of the government of the Virgin Islands shall compensate the facilities for uncompensated care in order to ensure the availability of qualified comprehensive health care to indigent as well as other residents of the Virgin Islands. Although the Virgin Islands Code specifically requires the funding of uncompensated care, the reality is that from fiscal year 2014 to fiscal year 2020, JFL has experienced a shortfall of $126.2 million due to non-reimbursement of uncompensated care by the Virgin Islands government by an average of 48%. We are appreciative of your support and the support of the executive branch in increasing our annual allotments by a projected 13.8% for healthcare that we can provide to our community. We would note, however, that the executive budget for fiscal year 2022 and 2023 have allocated $26.75 million to JFL for a projected $43 million in uncompensated care, which is a loss of $7.1 million to JFL. JFL depends on our appropriation to ensure that we meet payroll and ensure payments of our vendors, many of whom are local small businesses. Please see the uncompensated care fact sheet for your review in your presentation folders. The territory's Health Equity Act would increase access to care on many levels, but more specifically, expand access to primary care and preventative care to many Virgin Islanders so that there will be a continuum of care and an ability to provide early detection of preventable diseases. We ask that you utilize your resources to support this act on the national level. It would truly have a large impact on the health of all Virgin Islanders by increasing funding to the territory's hospitals and decreasing healthcare disparities in our community. JFL's recovery. Although the build of JFL North has been met with challenges, we have taken every opportunity to reduce delays through remaining engaged and reminding all stakeholders at every junction that at the end of the day, this is St. Croix's only hospital. We are committed to providing this community with a hospital that meets our acute care needs as we build a permanent JFL hospital. As of May 5th, 2021, the Territory Board has appointed Mr. Darrell Smalls, the Executive Director of the Hospital Redevelopment Team, to manage the completion of JFL North. JFL welcomes Mr. Smalls' assistance. In February of 2021, we celebrated the onboarding of FLAD, a national architectural and engineering firm, for the master planning and design of a new state-of-the-art permanent JFL hospital. In May of 2021, we completed the closing for the land located at 7 Diamond Ruby. We thank the 34th Legislature for your vision and for working with us to ensure the best canvas for our architects to utilize for the building of the JFL hospital in the future. In conclusion, the new hospital build project and the new medical campus is a significant, viable, and stable economic base for our St. Croix community, and eventually the greater Caribbean region. This week, the JFL executive team hosted a unique and long overdue on-campus strategy session to share our mission and vision for acute healthcare expansion for the St. Croix community with the Committee of Health, Hospital, and Human Services. Our objective was to demonstrate that JFL is an anchor institution that will provide not only quality healthcare to our community, but will ultimately serve to boost our tourism, provide economic growth, long-term careers, and develop sustainable pipelines. Further, the growth of our healthcare infrastructure, both acute and outpatient, will also serve to foster stability for those seeking retirement, relocation, or establishing a home base for a growing family while we look to a stable hospital and access to care as a deciding factor prior to their relocation. As a premier employer in the territory, highly skilled and highly educated individuals will create stable job growth projections in the new healthcare sectors to include healthcare facility maintenance, research, innovations in telehealth, artificial intelligence, information technology, and specialties not previously available within the healthcare system in the territory. Other wraparound services, such as urgent cares, diagnostic centers, and private physician offices, will increase access to quality care and create an even greater positive economic impact to the community. As an anchor institution, JFL would also be in a unique position to establish joint partnerships and global entrepreneurship opportunities. The JFL executive team looks forward to these initiatives and the completion of the new build projects as we rebuild today for a healthier tomorrow. We anticipate and we are working to project the growth of our healthcare industry, inclusive of new innovations and service modalities for the next 20 years and beyond. We would like to thank the entire JFL family for being the very foundation of the healthcare system that we are working to build in this territory. The dedication of JFL team members is unparalleled. Not only do they perform their duties with pride, but we bring them into construction meetings and walkthroughs of JFL North, and they talk about the needs of their patients from the NICU to the care of our eldest and wisest patients. Team JFL, it is you and your passion for our patients that drive the innovations in healthcare we intend to incorporate into our patient-centered care model. To the JFL executive team, I continue to thank you for working to develop new solutions to old problems and ensure the stabilization and the growth of our new JFL. To the members of the St. Croix District Governing Board, who are warriors for improvement in the provision of healthcare, I say thank you. We also thank the Territory Board for their service and commitment to JFL, as we cannot serve the needs of our community without their continued support. I want to thank the Senate Finance Chair, the Honorable Kurt Vialet, for always taking the time to listen and to proactively support the needs of JFL and the members of the Finance Committee for the opportunity to provide this testimony here today. I look forward to any questions that you may have. Thank you.
Thank you so much, Interim CEO, for your testimony. Colleagues, we're going to go into a 6-minute round, and we're going to begin with Senator Carrion. Senator Carrion, you're recognized.
Good morning. Good morning, Interim CEO. Good morning, to your team that is here and those that are connected virtually, and good morning to the people of St. Croix and my colleagues. I'm trying to figure out where am I going to start. Let's start about, we heard you mention some accomplishments and so far. What's the status of your operating room?
Currently in our operating room, we have expanded from 1 to 3 operating rooms, and they remain fully functional.
So all 3 are functioning. Great.
Yes, sir.
Training budget. Have you included what amount have you set aside for training?
And so I will defer to my CFO and my chief of HR, but specifically our budgets are essentially central to the organization. And so I wouldn't say that we have a budget per department. We have to manage our limited resources and respond to various challenges as they present themselves. And so,
Hi, good morning. This is Chanel. So for fiscal year 2021, we have budgeted $121,058 to be put specifically towards training.
Okay. And in FY21, I know you mentioned some training that took place. How many people participated?
if I might defer to Chief of HR, Ms. Terry Lynch.
So I wouldn't be able to give you specifically for each particular program. If you was interested in a specific program, then I can get those numbers for you, because in the testimony, she presented a comprehensive overview of several trainings that took place for 2021.
Okay. I just want to make sure that we are taking advantage and really developing our people. So I would like to know generally how many people went through a training process, or it's a workshop or a recertification or anything like that. Do you have a general number?
Again, so for our,
If you don't, then it's fine. You could
Yeah.
submit it to the committee,
can.
just so I can have an idea of what your personal development that is taking place. Now, with reference to patients having to fly or being transferred from JFL to other medical institutions, how many patients have we flown out of the territory for FY21?
I would say that's approximately 7 persons thus far for the year. And essentially, every month, we look at those numbers. We look at an average 1 patient every day, every other day. And that is the number that we work feverishly to reduce, because we do recognize that our patient populations should be served where they live, first and foremost. And so we focus primarily on those clinical lines of service that we tend to transition out of the territory.
Good. So for this fiscal year, only approximately about 7 patients have been flown out of the territory.
I wouldn't say just 7. I would say it's more on.
Okay.
So we're actually averaging about 6 persons per week. So that's the amount that we really transfer out so far for fiscal year 2021.
Okay. And because that represents a loss for your revenues.
Absolutely.
As you mentioned in your testimony. Now, I was glad to see that JFL is looking into telehealth. This is really, really a crucial step moving forward, so I commend you and your team for moving in that direction. And you said the cost that's been budgeted is approximately 6.1 million.
That's for the Meditech upgrade specifically. The telehealth amount is a grant that we're currently pursuing.
Okay. Oh, thanks for clearing that up. Do you have a timeline for this, for implementing?
So the implementation for the Meditech upgrade is really, really dependent on sourcing the $6.1 million, so we wouldn't have a projected timeline. And the telehealth grant that was submitted by our CIO is in the final approval process, and so we're hoping to move forward with that portion of our expansion of our IT systems.
So no direct timeline at this moment.
We're
2
still trying to
minutes.
source the funding.
So if I may, in terms of specifically the telehealth portion of it, while we did apply for the grant, we do anticipate being able to start that by the beginning of fiscal year 2022, because there are other opportunities that don't cost as much that we should be able to start prior to potentially receiving the grant.
Thank you for that. Now, what is the national standard average time for a patient to be waiting in the ER? We know we hear constant complaints from members of our community about the long waiting hours. What are the standard national average time? Because I know this also represent, like you said, a loss of revenues for JFL. And you identify approximately, if I'm not mistaken, maybe 11.4%, which it's approximately 1.3 million.
Yes, sir.
So what is the standard national average, and where are we averaging us here locally for our patients that are visiting the ER?
I don't have that number presently here with me. I would have to defer that to my Chief Operating Officer. She is available virtually for that more specific number. Ms. Thomas? Ms. Hazel Filbert? My apologies. Ms. Filbert?
Sure.
Standard
Good morning,
wait times?
everyone. I'm Hazel Filbert, Chief Operations Officer. To your question, Senator, regarding our average wait times in the ED, typically we look at it in various segments. So nationally, you would be expecting our patients, for example, in terms of their wait time, their first time to their actual arrival time to contact time, typically about 30 minutes nationally in terms of top tier institutions. Yeah. These are the benchmarks that we've been looking at, and those provide a guide to us. In terms of how we're doing, for that relative, we're averaging about 1 hour thereabout.
So that's the first contact. And then to be able to be seen inside.
Okay, so in terms of from the time they've seen the physician to actually having, so there are 2 things we need to look at. So they come to the ED, so it's either they're going to spend their time in the ED, or they could also spend their time in the ED and be transferred to the floor. So I'm pulling up my information here to provide that information to you, so just bear with me for a little bit.
And as you provide that information, I know at one point we had the fast track. We don't have that anymore.
Yes. No, we don't have that anymore right now in terms of being fully operational with our fast track at the hospital.
Time.
Got you. Is that
But in
something we
terms of
plan
our
to
first,
implement
if
as
I
we
may,
move?
if I may, Senator,
Yes.
in terms of our first contact time to being admitted, nationally, in terms of the benchmarks, is about 1.65 hours. We're averaging about 6 to 7 hours here at JFL. In terms of the first contact time to depart time, so for example, these would be for patients who come to the ED and then are discharged. Nationally, our benchmark is 2.45 hours, and we're averaging about between 5 to 6 hours here at JFL.
And have we made some improvement compared to other years? Are you following those numbers? I know, of course, that we have some challenges at the JFL right after hurricane, so I am aware of those challenges. I just would like to know if we are improving where we are falling in that area, and to ensure that hopefully when we move to JFL North, we will see those numbers improve much more, and our patients won't have to wait more than what should be the national standard time of waiting. Thank you, Mr. Chair, for your time.
Thank you, Senator Carrion. The wait time averages, you said 6. So what's the high, what's the low?
Senator, Senator Viola, I provided the average times. I would have to look, as we know, in terms of there are certain times where it could vary, typically, in terms of maybe based on certain whether or not what the type of the acuity of the patients that we have been seen in the ED at the time, and for several other reasons in terms of staff availability, etc. So in terms of the actual variations, I would possibly have to get back to you regarding this because I don't have the specific fluctuations on a day-to-day basis as to our specific highs and lows. Okay, and also too, we also have pending transfers in the ED at the time. So there are a couple of factors which actually affect the emergency department throughput. So if we're looking at, for example, what's the high, what's the low, I have to go back in and look at specifically how that has been varying. But typically that's the average. The averages presented are what it is that we've been looking at for the hospital.
Okay, I know are you charting those numbers on a regular basis?
Yes, so as part of monitoring our emergency department performance, this is something that's very high on our radar.
Okay.
So there's something called our emergency department tracker, where we actually pull those numbers from our Meditech system, but it's typically based on an average basis in terms of, the overall for a month, for a day. So I'd have to go back in to look at it, but we track it typically
Okay,
on a
hold on.
month-to-month basis in terms of our reporting.
You're giving me a real long answer for a very simple question. I mean,
I'm sorry, Senator.
you just need to say that the wait time has gone as...
Did I answer your question?
Hold up. You just need to just say the wait time has gone as long as 12 hours sometimes. Sometimes it's 2 hours.
Yeah.
Just be honest. We need to improve. We have issues. The emergency room is used for blah, blah, blah. But, I mean, when you said 5 or 6 hours, the community out there just rolling on the ground saying, please, really, ask a question. I've been there for 10 hours. I've been there for 11. Just say what it is. We have to improve in certain areas, and it is what it is.
Yeah, to your point, Senator, if I may, you're absolutely correct. And it's simply an average, and we do have fluctuations. So someone could wait as a minimum of 30 minutes, or it could be as much as 8, 10 hours, 12 hours,
Okay.
to your point.
Okay. I know some institutions, I've seen them put up the sign with the average wait time where you come in and the
Yes.
average wait time is 3-4 hours, so individuals know exactly how they're able to prepare themselves. I want to welcome Senator Blyden, who has just joined us, and Senator Noble Francis. Thank you for coming. I don't know if anybody else have joined us on St. Thomas. Senator James, you recognize. Oh, before I go to Senator James, the $6.2 million you said is for which system?
Grade 6.1.
Meditech upgrade or Meditech new?
Meditech upgrade. We currently utilize Meditech. This is the system that's about 7 years behind in terms of versions, and so it's specific to upgrading the current Meditech system.
Okay, and that is a system where you have like the clicker and you're able to, the barcode and the information?
It's inclusive of that. It's essentially the entire IT network of the hospital. It manages our inventory controls, supply chain management, our reimbursement, our billing, our physician documentation.
And
Every aspect of our facility is dependent on this IT system.
And the old system does not have the capability?
It has a modicum of the existing capabilities, but we do need to increase our capacities, including the barring and the wanding systems and some innovations in terms of remote access and that sort of thing.
So the old one that we presently have don't have the bar and the barcode.
Not currently.
Okay, that's what I'm trying to get.
Yes,
and,
sir.
Colleagues, that is needed not only at Wang Lu, it's also needed at Snyder. They have also made a request for the same amount of money. Point of information, Senator Blyden.
Thank you. Thank you, Mr. Chair. Good morning
Good morning.
to all. In respect to the Meditech, the expansion of it and the upgrade, what return on investment, what type of revenues can we see extra as a result of that upgrade moving forward with the hospital in terms of assisting you with your revenues?
So it's not an actual number that I think I can produce right off the bat. What I will say is that with the expansion of our Meditech, we'll be able to make our process overall more efficient. We'll be able to streamline our services. We'll actually be able to qualify. They do have grants and opportunities to get funding just for having up-to-date EMRs. So that's what we're looking towards.
Thank you so much. Senator James, you recognize.
Good morning to the people of the Virgin Islands. Good morning, testifiers. I see here, I think it's on page 7 of 19, which speaks to the virtual visit platform, which speaks to an online patient portal. And I see here that you're seeking a grant offered by the CARES Act. Do you have an idea of how much will be awarded to us once completed?
So we actually put in a request for about $850,000, and so we're waiting to hear back to see what that final would be.
And the number that you gave me was based off of what assessment? Is that something you did internally or something that was recommended by some outside party?
In order to figure out what we think the revenues would be from this type of investment, we looked at what was being the leave without being seen patients. So these are patients that are coming to the emergency room and are leaving without ever actually coming to the back, maybe because the wait is too long. And so our hope is to try to reduce that. So that 11.4% actually represents the patients that come and then don't physically finish their visit, and that's revenue that we're losing. This virtual visit will potentially allow us to be able to capture that, because then they can actually have their visit remotely and not have to come in and experience the long wait times in the ER.
And I can see this really benefiting the territory, and I hope and pray when this comes into fruition that there's a serious marketing campaign and strategy to make sure that individuals take advantage of this virtual visit platform. And that would be online. Would that be an app? How would that be carried out?
So it would be an app, and our CIO is actually working to finalize the development, and it also depends on the software that we're able to procure based on the grant we receive.
This is awesome, and I can't wait to see it come into fruition. And I see where in the testimony, it was made mention of the net collection rate, which is referenced as a major key performance indicator. As far as carrying this out, what you truly need to make sure that this is successful and we could be able to identify our performance indicators, what would be needed to carry this out?
So for that, we really need to look at making sure that our billing is optimized 100%. We want to bring billing back in-house. We want to save some of the money that we're spending with the off-site billing company. We're looking at our process. We're looking at our processes right now and seeing where we can ensure that every process that we're doing is optimal. We're also looking to make sure that we increase our charge capturing. One of our newest ventures was a total joint program, and we spent a lot of time specifically with that program, making sure we're able to capture every charge possible, because every charge we're able to capture, we're able to code better, and then we're able to get reimbursed at a higher rate.
And thank you for that explanation, because between the net collection rate initiative and the virtual visit platform, I can see where you can be able to solve some of your deficits? Because I'm seeing here for the FY 2021 budget, we had expenses of what, $83 million and a profit loss of $18 million. So hopefully when those things are implemented, we can deal with some of our shortfalls. As far as those conversations being had, as we speak about the budget and revenues, what is the long-term plan to deal with those profit and loss? I know we have also an issue with uncompensated care in the territory, but can you just explain to me what's the long-term plan to deal with some of those profit and loss?
Sure. So
2 minutes.
for the overall long-term plan really is to, number one, stabilize our environment of care at JFL, increase our lines of services, bring in new lines of services, stabilize our staffing, and the Parity Act that Ms. Williams, ICO Williams mentioned in the testimony, that if we're not able to be reimbursed appropriately, we're gonna always be in the financial hole that we're in. So we can do as many services as we can. If our payer mix remains at 75% Medicare and Medicaid and self-pay, it's going to be very hard. So that's the hopeful long-term goal.
And is JFL having a hard time getting access to the COVID-19 funds? Is that going smoothly?
Oh, yes.
All right. And who is the liaison or the person that you're dealing with when it comes to getting access to those funds? Who is that?
So I mostly deal with Director Williams of ODR and, of course, Director O'Neill of OMB.
Awesome. And in addition to that, I see here where you plan to have certification opportunities for critical care staff in the future. So that is an initiative that's going to cost you money? And if so, is it factored into the budget or that's later on down the road?
So yes, any program that we implement to upskill our employees will require additional funding. The current program that you're mentioning is the certification for surgical technicians, and that right now is part of the existing budget.
And is there any way you could try to tap into the $10 million that we should receive from Department of Labor? I know at some time I had a conversation where we had that conversation by JFL, and I asked if you could reach out to Commissioner Gary Molloy and the Workforce Development Board to try to see if you can tap in, not to all, but at least some of the $10 million that is available for workforce development.
So I will definitely reach out to the commissioner again. The surgical tech certification program is one of many of our initiatives that we have planned for this fiscal year. Actually, we are working towards more apprenticeship workforce development programs. So definitely any support that we can get from any of our public stakeholders and our community stakeholders will be helpful.
Thank you. And this $1.1 million that is owed to GRS, that is all that is owed?
Time.
Currently, yes.
Okay, well, we definitely need to address that because I see here in the testimony where we have individuals who are retired and they're complaining about not being able to receive their retirement check. And right now when things getting harder, WAPA just got to increase, and the cost of living is going up. We want to make sure that individuals can retire when it's time to retire. So we will make sure that we deal with that situation. Thank you, Mr. Chair, for the time.
Thank you so much, Senator James. What was the amount originally owed for the GRS? It was way more than that.
When I first arrived, it was $1.9 million.
Okay. And that was a result of it not being paid for a number of months or years?
Years. Oh, 2015 and back.
Okay. The surgical tech certification program. So, Ms. Lynch, you have called Department of Labor and asked them about the apprenticeship program, or?
Yes. I think after that meeting where Senator James had shared the information, I did reach out. I can say right now there wasn't much movement, so I can try.
Who you spoke to in the department?
Sorry, I can't recall who I spoke with. I can get that information to you.
I'm just totally shocked. You know, we have all of these federal monies for workforce development. We have to spend the money, $10 million. They're saying they need to design program. And you have a program that's ready to go and you have not received any feedback. What's the cost of the surgical tech certification program?
So right now we are in the very beginning where we're actually ordering the supplies, which would be the books. And that,
What's the overall cost you think is going to be to the hospital?
I can give you an approximation. I'd say about 3,000 to maybe 5,000.
That's all?
We're doing the program internal. We're utilizing our current staff to support the training needs. And so we're really looking at books, essentially.
So
Go ahead.
the 3,000 to 5,000 will cover supplies, and then part of that also is looking for expert instructors and supporting those costs as well.
So it's not 3,000
I said 3,000 to 5,000.
to include the experts, the teachers, et cetera, or you're going to have in-house staff?
It's in-house staff, so
And they have
so
volunteered the time to do it?
either volunteer or they'll be compensated with overtime if it's beyond their.
No. You're already spending enough money for overtime. You need to write a formal letter to the Department of Labor outlining all the costs and see whether or not Department of Labor could fund that particular program. I think we just entered into a contract, what is it, ICF, for some I have it somewhere here on my phone, some $9.6 million for workforce development. So if workforce development is going to take place, we need to make sure that we have programs and not just a company that's receiving the monies. I'll find a contract in a minute. Senator Fred Gregory. Okay, media no song on the live broadcast I'm hearing.
Thank you, Mr. Chair, and good morning to all, and good morning to the testifiers.
Senator Fred Gregory,
first off-
wait 1 second. Let me just check something because these are medical professionals that are reaching out to me. The committee will be in recess for 2 minutes. The Committee of Finance is back on the record. You may proceed, Senator Fred Gregory.
Mr. Chair, and good morning to all. First off, I would like to applaud the leadership of JFL for implementing the benchmarking recommendations that were made by this body. I want to say it was last fiscal year or the fiscal year before, so you ought to be commended for that. I know that several testimonies ago, you made reference to the fact that you are looking to the need, rather, for the anticipated opening of the JFL North is some 300 plus additional employees. What are you doing to move forward with getting those positions filled? I did see that you have a recommendation or projection here for a marketing firm, but what is it that you are doing internally to address the filling of those positions?
I will defer that question to HR Director, Ms. Terry Lynch.
Good morning, Senator Fred Gregory. We have several initiatives in terms of recruiting. One of them is on the internal side. So currently we are using our social media platforms, and on our social media platforms we advertise for critical hire positions. We're also using the Indeed platform to recruit for all of our critical hires as well.
And how is that working for you?
Actually, I have to say, if I was to give you a percentage, an approximate 90% of our hires are from both the social media advertising and also the Indeed advertising. We also use in-house, because one of the things that we recognize is that our employees are ambassadors, and so we do use word of mouth referrals coming from some of the employees. And so, like I said, if I was to give you a percent of how successful that is, about 80 to 90% of my hires come from that avenue. We also
and within this past fiscal year, how many new hires have you seen?
As of April 2021, we were at 42 gains, meaning hires.
42 new hires, and how many of them are, in fact, medical personnel?
So out of the 42, I will have to get those specific numbers to you. I don't have the specific number, but I can give you an approximate.
Important.
Excuse me?
You could give the information. You can look for it and provide it to us before we're ending here today. I note specifically that in the testimony, and this I guess is for Ms. Moorhead, you indicated that you plan to see an increase in revenues in the upcoming year as well as this year. Are those revenues based on billed services, or is it a combination of billed services as well as revenues from federal funds?
For fiscal year 21, we're actually looking at the billed services, and in the package under the revenue tab, you can see how we're actually we're looking to exceed our budget by about $3 million this year.
Okay, I saw that, and I'm glad that you said that. So you're looking to exceed your budget by $3 million. I think it's like 3.7 million. However, how does that align with your revenue? So your budget is one thing, but how does it align with your revenue projection, your actual revenue receipts?
Sure. So you can see from
2 minutes.
I'm sorry.
It says expenses and then one that has revenues. So I'm trying to understand the true alignment. Is it the 3.6 million that you anticipate seeing as total at the end, that you'll see additional resources at the end of the year? I don't want to use the word profit because you're not for profit. So 3.6 million?
Yes, so when you look at actually what we collected, we're expecting to see an increase there of exceeding our budget of about 1.1. And then we did add in the COVID funding that we received, which was 3.1 million. So that's how we're able to come up to that 3.6. There is a
Okay, so your net collections, your GVI appropriation and your net collections, the aggregate after your net is actually absent of the absent of the COVID funds is only the 1.1, correct?
Yes, ma'am.
Okay, understood. All right. So tell me about your uncompensated care. I know that you stressed that in your testimony. How is that working as far as the presumptive eligibility program? How are you? Do you have a desk or some area within the hospital where individuals would, provide their information so the presumptive eligibility will be taken care of upfront?
Yes, we do. All of our registration staff are trained in order to be able to qualify persons for presumptive eligibility. And we also do have an office situated in the hospital that is where Department of Human Services Medicaid division personnel are sitting in there. And so persons who have been deemed presumptively eligible can actually come to the hospital and don't have to go to a different place to really do the full conversion.
Thank you. So based on that system that you have in place, are you seeing an improvement? I mean, I think I see the improvement in your projected excess revenues, but are you truly seeing improvement in your collections?
We are seeing a small improvement, but I actually attribute that to a program that we implemented this year relating to gift cards being handed out to those persons coming in and proving that they actually did fully convert to Medicaid.
I see. Okay. So let me ask you, because my time is about to be called. I note that on page 12 of your testimony, you spoke specifically about intra-agency debt. And the amounts are very alarming. Is it that 12.1 million?
Time.
Because I think you're pushing it. Mr. Chair, can I complete my train of thought?
Yes, you
here?
may. Go ahead.
Yeah, I know that you are pushing it forward to as of May 2021. You have a date of May 2020 where it was like 8.3 million, and then in May of this year, there's some 12.1. So the amounts continue to mount?
Yes, actually, for this last fiscal year, the biggest one that jumped up was the Bureau of Corrections, where that increased by about $3 million.
So this is for services that the hospitals are providing to the inmates. And what type of agreement do you have with the Bureau of Corrections to addressing this situation? Do they qualify for presumptive eligibility, and do they qualify? Do they have to go through that same process?
They would have to go through the same process.
And is that occurring?
So we don't have an actual agreement right now with the Bureau of Corrections, but that's something that I do plan on working on with this coming fiscal year.
Because if this bill continues to mount, there must be some way to stop the bleeding here. I see you have the same issue. So tell me, what is your issue with the Department of Human Services? Your $2.5 million issue. Same thing?
Yes.
Yeah. Is there communication? I know my time has been called, so I have to wrap up. But what type of communication are you having with these departments in particular? I know of the issue with labor, but what type of discussions are you having with BOC and DOH?
So my team does have a specific person who's assigned to interagency, and they do send out the bills and statements monthly. But one of the objectives for myself is to really reach out to the agency heads to see how we can come to a payment plan or agreement.
So we're not using the Medicaid program for this? For these types of patients?
It would depend on the patient and if they qualify for Medicaid.
So do you have a system in place to make sure that once those types of patients come into the hospital, that they go through that same presumptive eligibility process?
Yes, all the patients, no matter where they come from, we would try to determine whether they have Medicaid already or if they're presumptively eligible, because then I can get paid sooner.
Okay, all right. Thank you for the time, Mr. Chair.
Okay, thank you, Senator Gregory. So those that are listed here are more than likely not eligible, or they just doesn't follow through with human services, et cetera?
So more than likely, the debts listed here are probably for, for example, Department of Human Services could be a behavioral health patient or somebody that doesn't have anything. And so that's why we'd be trying to work with the different departments to make sure they have their documents together to try to get them to get covered.
Okay.
Senator Viale,
Yes.
I have a point of clarification. if
Yes,
I
go
may.
ahead.
When you asked a question about the cost, and I said $3,000 to $5,000, that was $3,000 to $5,000 per participant.
Okay.
I needed to make that clear.
And you expect to have how many participants?
For each class, 10 participants.
Okay, so that's 30 to 50,000. Okay. I'm reading this contract here. Where the government of the Virgin Islands have hired a contractor to manage the Community Development Block Grant Disaster Recovery Funded Project for the Virgin Islands Department of Labor Workforce Development Program Management Services. The contract is in the amount of $9,010,085. So we need to make sure that that $9 million is spent on providing workforce development for people at the Virgin Islands. And you could start this program, so I'm going to ask you, Ms. Lynch, to formally write Department of Labor in reference to the Surgical Tech Certification Program.
And others.
And the others that you have. Now, in reference, you said, how many vacancies are you trying to fill?
Currently, we have 176 vacancies.
Well, let me change the question. How many funded vacancies are you trying to fill? Because that's a wish list. How many funded vacancies in which you know the hospital have sufficient funding?
I will defer to my CFO to answer the funded question.
So we do have in our budget approximately $57 million for personnel and fringe, and so it really just depends on the.
Where are you at now?
Yeah. Where we are now in terms of
57 million total. Where are we at? 50, 51, 54?
1 second.
Okay, before I go to the next senator, let me get it. The graduate nurses, because it's bothered me not only at Juan Louis, but also at Snyder Hospital. It is my expectation that when our children graduate, when our students graduate from the University of the Virgin Islands, that they will immediately be offered a position by Juan Louis or Snyder Hospital under a graduate nurse position, and would be given a year to pass NCLEX. And if they don't, then they depart from the hospital. What is the reason as to why we can't do that? Because I know these nurses have not been offered positions on St. Thomas or St. Croix.
So there's not a reason why it can't be done. I can tell you moving forward from the conversation I had with you that we have begun building the program. So it didn't exist.
Okay.
The program
Hold up. To me, this is an easy program. You're hired and you have 1 year to pass. If the hospital want to provide some additional resources to help them to pass, that is fine. But the data out there shows that over 90% of UVI graduates pass NCLEX. So you have a pool of individuals where the passage rate for NCLEX is extremely high versus Inter-American, where the passage rate is less than 50% or less than 25%. So what stops you from creating a salary scale and hiring them as graduate nurses, knowing that within a year they'll pass NCLEX and you'll have full-time nurses? What's What stops us?
So that's the work that's being done. So it's not as simple as today we want to hire a graduate nurse and then we just launch and we have a graduate nurse program. A graduate nurse program is a structured program that includes not just the clinical aspect that where they're gaining the experience that's going to help them to pass the NCLEX. You also need to have preceptors, you need to have a policy, you need to have a job description. And so all those things are being worked on as we speak. The target date for us to at least have a fully comprehensive graduate nurse program is for August of 2021. And it may be before then, but that's our targeted date.
So by August of 2021, we're going to be sending out letters to all of the graduates offering them a position?
That's the goal.
We didn't have a graduate nurse program before?
The last time that we had a graduate nurse program was in 2012.
Do you want to involve in that?
Yes, I was the one that created the program.
So what's so hard now? If you create it, it's yours, you know to do it.
At that time, we had a fully staffed education department, and we had one educator that was dedicated solely to that program.
Okay. This is the only way you're going to get local nurses, okay? We're losing them. Some of them gone already. We have to capture them as soon as they graduate. We have to capture them. We have to have a program in place at both hospitals. We are not linking with the University of the Virgin Islands. We hear in government say we can't find position in this or that, but they're not actually going to these students and saying, hey, you guys come from the School of Accounting, here is a letter for employment. You come from the School of Science, here's a letter. We got to be able to capture these individuals so that we don't have to import as much nurses to the Virgin Islands. Okay, we had two. Senator Gregory, 1 minute. You're doing point of information with Senator Francis, who asked before, and then I'll come to your point of inquiry. Senator Francis.
Thank you very much, Mr. Chair. You know, it's just frustrating to hear this whole discussion about our graduate nurses and the fact that, you know, who's really minding the shop. I mean, you know, we have had this situation for quite some time. We know of the difficulties in us being able to recruit local nurses. As a matter of fact, we have spent millions of dollars on travel nurses. So I'm saying that if we see a low-hanging fruit where we're able to captivate our youngsters and give them an opportunity, a seat at the table, ain't nothing like having a local nurse here. Yes, we want them to go away, diversify if necessary, and come back. But we're really losing an opportunity here to make sure that we're nurturing our own. You know, so I believe that whatever the barriers are, we should try to just remove those, come up with the graduate program as required, and let's get these graduate nurses, bring them in, because, you know, 9.9 times out of 10, we know that these individuals are going to pass the NCLEX, because that's a regiment that that's already being done over at UVI to ensure that they almost have 100% pass rate. You know, so let's not miss this opportunity to really get those graduate nurses. And if there is some support that's required from this body, then certainly we want to hear it, and let's try to assist there. But you know, we have to stop the bleeding. Thank you.
And if I may, just for the record, there's 16 graduates from UVI that have joined JFLs in 2020, for the record.
That have already passed NCLEX?
Yes.
Okay, so this is a bridge between that?
Yes.
Between
Yes,
getting
absolutely.
those? Okay,
Absolutely.
So for the record,
recommendations, because I have, now Senator Fred Gregory, go ahead, and then I'll ask a question.
Thank you, Mr. Chair. I have to go back to this issue with the Bureau of Corrections and this outstanding amount. I looked at the month of the year, May of 2020, and our current year of 2021, and we are seeing a $3 million increase as far as this outstanding debt. So I am trying to really wrap my head around why we would have such a significant increase of in this particular category when we have the Medicaid program. I need to really understand, how is this program working? What is that collaboration between the hospital and the Bureau of Corrections in particular? There is a 90-day window prior to you actually billing the Bureau. So help me to understand how we could see such a $3 such a significant increase of an outstanding debt over a year when we have the Medicaid program, and I'm certain that most of these inmates qualify. Something is not jiving here.
Great.
I mean, if you need to look further into it, that's fine, but it's troubling me.
So I will continue to look into this and make sure that's one of our key priorities for the next fiscal year. I did want to clarify too that we don't bill the individuals, we actually build the facility itself. We are trying to work with the facilities to make sure that they're getting all the necessary coverage that they can for their wards. But I will continue to work on this interagency report and see how we can get some payment plans going and provide more information.
Yeah, this needs to be addressed. I just can't imagine that we have a mountain bill of $5.2 million with the increase in our Medicaid program here in the Virgin Islands. It just doesn't sit well, and I am certain that the majority of our inmates qualify for this program. So that's something that we expect to see some improvement on. Thank you, Mr. Chair.
Senator, I just instructed my staff to send a letter to Bureau of Corrections to find out whether or not the inmates are applying for that presumptive eligibility and whether or not there's any follow-up. Because after you apply, you have a period of, 60 days?
You have until the end of the following month to fully convert. If you do not convert by that time, then you're not eligible for Medicaid for, I believe it's 6 months. 6 months to a year.
Okay, let's take a 1-minute recess. I think we lost some stuff. Let's recess for 1 minute.
Senator Bailey, I have the personnel number.
The Committee of Finance is back in the record. Before I go to the next senator, Senator DeGraff, we did have a discussion about the presumptive. We did have a discussion. Okay, somebody need to mute their mic. We did have a discussion about the presumptive eligibility and Bureau of Corrections. And Senator Francis, as chair of the Committee of Health and Hospitals, will be holding a meeting with Director Tessamark, Commissioner Kazi, Ms. Moorhead, so that we can be able to align that entire process. And we're hoping that it will result in a mass registration of those individuals who are in Bureau of Correction for Medicaid. So I think we need to discuss all avenues in which we can increase the collections to the hospital. So we're going to look as to the possibility of making that work, find out the parameters as to whether or not they're eligible. If they are, then we'll come up with a mechanism as to how we can make sure that they are registered. In reference to the Department of Labor and the Workforce Development Program, there is some $9 million. Some of the money is for salary, but a large percentage of the money is supposed to be utilized for programs. The surgical tech certification will qualify for that. And the graduate nurse, if that's an apprenticeship, should qualify for that program. So I'm asking Ms. Williams if you can have correspondence sent to the Commissioner of Labor. I think the name of the company is ICF. I'll see if we can get that information. But the Commissioner of Labor for both of those programs. And Ms. Lynch, if you can expedite being able to make sure that you have all the policies, et cetera, as quick as possible for the program. August is a bit late for me. I would like to see it done by the end of July and let us send out to everybody, because the longer that we take it, the more individuals we're going to lose. Senator DeGraff, you're recognized.
Good morning, Mr. Chair. Good morning, colleagues. Good morning, testifiers. I'm glad you say you put that in Senator Francis' committee, because presumptive eligibility is something we've been talking about from the 32nd legislature in regards to the health facilities taking advantage of. Along the lines of presumptive eligibility, one question I had was what you're seeing in the departments. Can the departments do any type of pre-registration to fast-track this whole situation, that they roll right into that eligibility program rather than having to wait for at the time of the event? Can it be done?
Senator, are you asking if the individual government agencies can do a pre-registration?
Right. So some kind of fast track where it would, anybody that come now, they have to put in, they would just be able to fall right in and have that system open already or something. I don't know.
Well, for example, for BOC, if we're able to come up with some type of collaboration where anybody under their command can already have Medicaid coverage if eligible, then yes, that would definitely be able to fast track, especially the billing side of it.
Yeah, because like I say, from the 32nd legislature, you've been hearing of this issue, and presumptive eligibility seemed to be the means to the ends, and I think we need to go that route. Again, to your team, I am a supporter of JFL and all the medical facilities in the territory. So for me, you don't have to sell too much in a budget. But a couple of things I wanted to find out. Again, salaries. You have unionized employees?
We do.
Have they negotiated the contracts or anything, or are they in any negotiations presently?
Good afternoon, Senator. The last round of negotiations that were completed, I do believe, was in 2018 for 6 of our 9 unions.
Is it the last or completed?
2018. Currently, we are in the progress of negotiations with 2 more union shops.
Okay, so just making sure that Now, I'm seeing in the post-auditor report where they said the top 6 payables owed to the owed by the hospital. Bureau of Internal Revenue, 6.9 million. What is that $6.9 million for?
That is for taxes that were withheld but not paid to IRB during that time period.
GERS, 1.1 million, up from last year budget. The post-auditor report had 7.6 million. Now you're down to 1.1.
Correct. Last year's audit number, though, includes estimate for interest and penalties, which we don't have an accurate figure for right now.
Okay, so that from 7.6 to 1.1 means if you have employees who want to retire, that's money owed that would hamper them from being able to go through the door?
Currently, JFL does owe GERS approximately $1 million, and yes, that will prevent retirees from being able to be on the payroll.
Those are priorities we have to address first. But you know, the employees are number one. That's how I look at it. You know, I don't know what else to say. But now I see you have in the employee appreciation section in the post-auditor's report where you have $22,000 plus your projected.
2 minutes.
I think it was 60 before.
Can you repeat? I didn't quite hear you.
The employee appreciation, post-auditor's report, where you're projecting 22,000 and change. But I think in the past post-auditor report, it was up to 60,000. You'll find the exact page. In the post-auditor report, you found that? Oh, you have a copy of the post-auditor report?
I do. It's right in front of me.
Okay, the page 5, I think it is. Employee appreciation. It's to, oh, I'm missing the numbers. Fund for employee appreciation. What number do you have? 20,000, 22,038 for FY22 projection.
Correct. And we've budgeted
Okay,
for
see,
fiscal year 20, we budgeted
21.
$60,000, yes.
Correct. So it went from 60,000 in the 21 budget to a projection of 22,000 in the 22 budget. How is that? But why is that?
Because we looked at the actuals being spent this current year, and we're projecting to spend about 20,000 this current year. That's where you see that 20,988 number. And so we're in being more in line with what we're actually spending. We are projecting to spend a little bit more, about 22,000. When we projected the 60,000, we were anticipating having multiple mass gatherings to really show our appreciation, and we've had to cut back on that with COVID.
Okay, makes sense. Now, for the new facility, you know, that in itself seems to be a task. What is the update on JFL's facility, the building and reconstruction of it?
So, Senator, we do anticipate the completion of JFL North in April of 2022.
Time.
You anticipate April 2022? Mr. Chair, if I may just 2 more questions. April 2022, you stated?
Yes, sir.
Okay, is there anything for, what is the alternative energy source, if any?
When you say alternative energy source, I presume you mean the completion of the CMU building?
Well, no, in terms of like, I'm sure you have generator systems that you're putting in.
Yes,
you know,
absolutely.
what site generators, or are we looking at any solar energy or anything for the facility?
Not currently, but they are, as a hospital facility, we are required to have some redundancies for our utility system, and that is already in place.
Okay, and they don't need any more funding for that.
No, sir.
That's cool. Okay. All right. Thank you, and thank you for what you and your team continue to do. Thank you. Thank you, Mr. Chair.
Thank you, sir.
Thank you, Senator DeGraff. Mr. Smalls, you want to provide some more information in reference to the process? July 1st, I know is a target date for the opening of bids.
Yes, good afternoon, Senator, Mr. Chair, and fellow senators present. Darrell Smalls, Executive Director of the Territorial Hospital Redevelopment Team. As you just indicated, currently we do have an invitation for bid and IFB out for the mechanical building, which is necessary to support the temporary structure. As ICO Williams stated, the projected timeline for opening of JFL North is April of 2022. Upon opening of these bids, one of the key points of this solicitation is trying to ascertain as to whether or not there are any opportunities in which we might be able to bring this building in sooner than that. However, it's really premature to really come up with a exact date. Right now, it is April of 2022. And once the bids are open and the team has a chance to review, we'll be able to make a more informed decision going forward.
Thank you so much for that answer. Senator Blyden, you're recognized.
Thank you so much, Mr. Chair. Good afternoon to my colleagues, listening viewing audience. Good afternoon, Acting CEO Williams and your management team there with you, and thank you so much for your testimony. First, I want to commend you and your team for, first of all, basically accepting recommendations from the body and implementing those recommendations that make sense on behalf of the people of the Virgin Islands, in particular St. Croix. And also, I want to commend you for the trainings that's moving forward at the hospital to include the CRAS training. It makes sense because you spoke to actually saving over $100,000 in related salaries, which is a good thing. And while I'm on the topic of employees and salaries, let me ask in terms of, I know my colleagues spoke to increases for the employees, but let me ask, when it comes to the post-audit report, because I don't know if it's an error, but it was showing me in 2021 for the CEO, it was showing a salary of $200K, but in 2022 it's showing $300K. Is that accurate or that's an error?
That is accurate.
It's accurate? Okay. So have we had any increases in 2022 for any of the employees slated?
What do you mean in terms of rate increase or step increases?
Yes.
Not for this calendar year,
Okay.
not thus far.
Okay. Based on a post-audit report, good afternoon, Ms. Moorhead. Go to page, on the post-audit report, go to page 4 of 27. Because as I went through the post-audit report, in every category is showing an increase in all areas. Let me ask you, when it comes to the techs and specialists under personnel services, they've increased from 17 million to 24 million, which is $6.9 million increase. What area are we speaking to in terms of supporting those increases?
So we did do an overall increase across the board for personnel and fringe of 40%, and that was because we do anticipate having to hire a significant amount of staff and also try to address some of the step increases. Specifically for that line item, there has been some, we're working to reallocate proper salaries where it needs to be. So where it says specialist, when they're actually allocating the salaries per position, some of it's getting convoluted with the RN salaries or CMAs, et cetera, because they're all considered specialists. So that is actually a culmination of across the board, the medical side, clinical staff.
Because I also saw an increase of $289,000 for LPN, CMA, CNA
Right.
salaries also. So I see you're looking to onboard the right staff and a proper amount of staff. What number are we looking at in terms of those individuals? Because I know you said you onboarded 42 already, correct? So how much more are we looking at based on these numbers that you're looking to put on a team to assist in services and will assist in bringing in more revenues for the hospital?
So currently, we have 176 critical hire vacancies that we are anticipating needs to be filled to support our team.
Okay, very well. Also, I saw, which you mentioned in testimony, from 16.6 thousand to 150,000 when it comes to advertising and promotion of the hospital, which makes sense. Let's go to collection fees. There have been a drastic decrease. In 2021, we saw 2,024,000. In 22, you have a projection of 626,000. Why such a large variance when it comes to that space?
So
2
for-
minutes.
For fiscal year 21, we do have our off-site billing company, which just charges a percent, and so that's where that high collection fee is coming in. Now that we're anticipating bringing billing back in-house, I do expect to see some savings there because we don't have that outside billing company.
And I'm happy to see also that your CARES funding, you have expended 11,792,000, and you only have 36,000 unexpended. That's very good.
And that funding is specific to finalizing the implementation of our temperature screeners.
Okay, let's go to your professional service contracts. There are many contracts here listed in the post-audit report. The design, construction, uptime, what's going on with that? Because it's ongoing from 2018. What's the expiration date?
So I do believe they got a contract extension recently, but I'll defer to our chief legal counsel.
Hi, good afternoon. So that contract has been extended with Aptum. That is to, of course, allow for the change orders that occurred for not only just the ambulance ramp, but also for the radiology section. Of course, there's additional work that does need to be done once we do receive the CMU building, because there is some testing that has to be done for a lot of the components in the building that cannot be tested because that CMU building is not completed. So that is where we are right now. The CMU building is the hold.
So the account service Inc. Is also being extended because that has expired in 2018.
Yes. So what we did is, because Account Services was a company that we had on the books for a while, and actually even when I got here, Account Services was here, we did release an RFP. It's RFP 2020-106 for debt collection services. We're in the evaluation process for finalizing a company to take over those debt collection services. So that should be forthcoming, hopefully within the next 2 to 3 months.
Okay, good
Time.
to
It
know.
should be
But
complete.
good to know about, Mr. Chair. There are many other contracts that's expired and or pending, and it would be good to know what's going on in that space in terms of, instead of having to vet, you should have the information there. For instance, the orthopedics procedure, there is a contract that expired in 2013, and the amount is 246,000. There are other that have been expired, so it will be good to know, what the status are with those contracts moving forward. And thank you so much for your responses, and thank you, Mr. Chair, for the time.
Thank you, Senator Blyden. Ms. Williams, your increase was by the board?
I don't have the authority to change
Okay.
the salary.
In reference to, you had a VP of Workforce Development, that is now the HR, that's you, Ms. Lynch?
Yes.
Had to assume multiple roles.
Okay, so we're seeing a $21,000 increase there also?
That is the salary of a chief of HR for the hospital historically.
And who's the change manager?
The change manager,
There's a position here listed, a change manager for $60,000?
yes, that individual works under the chief operating officer.
And what's their scope, what's their role?
So I would defer to the chief operating officer to really expand on that response.
Okay, I'm Hazel Filber, Chief Operations Officer. The change manager is currently assigned to work with the department, the Quality and Performance Improvement Department, which is also under my direct purview. So this individual plays a critical role in terms of the key functions in the department, in terms of moving the performance improvement agenda forward for the hospital, participating in key meetings, documentation of key meetings, also to building the repository for our survey readiness that's supposed to be ongoing. Also, the individual is very much involved in a lot of the key activities that we have to push forward from the quality department. In addition to this, is also to a good resource to the quality department because currently we are understaffed in terms of key positions that we need to have. So this is pretty much an added complement to the department.
Is the title appropriate? The word change, manager?
Well, it's a title that we've had from in terms of some of the key things that we've done. We had this title a few years ago and it's been carried on to this individual. So it's more or less appropriate for the scope of work that's been done by the individual.
Okay, thank you so much. Senator Francis, you recognize.
Thank you very much, Mr. Chair. Good afternoon to you, to the people of the Virgin Islands, and certainly to the JFL team. I first of all want to thank you for your comprehensive testimony this morning, and really to thank the hardworking men and women of the JFL Hospital and employees for their continued commitment, especially during these rough, dire times. We certainly appreciate them continuing to put their life on the line for this community. Thank you. Mr. Smalls, in regards to that CMU building, you mentioned that it'll take perhaps about 9 months from the opening of the bid for that building to be completed. Have you assessed what it'll take for the technical equipment or any specialty equipment that also should be ordered in a timely fashion so that there will be no continued delay?
Yes, good afternoon, Senator Darrell Smalls here again. Yes, the project engineer, or I should say the architect of record who developed the plans and specifications has been able to provide the team those major long lead items, and the way that the bid is structured, the responding entities will have to provide that information to help facilitate, to ensure that once a contract is executed, those items are brought forward immediately so that the purchase can be done right away, to ensure that once the building is officially completed, that those components would have arrived and be installed to be able to meet that target deadline. I can tell you we're working diligently. We can't wait for those bids to be open so that we could work with a contractor to make sure that we can deliver this project on time, and more importantly, if there's any opportunity to bring it in ahead of schedule, that is our priority.
Was a similar building constructed in the St. Thomas Royal Leicester Snyder Hospital?
No such building was built on St. Thomas.
Okay. So you're pretty confident, based on all of the information that you have before you at this time, that in fact that everything is in line for us to be able to get this build out completed within the time frame that have been established?
What I will tell you is the opportunity is there to make it happen. It's really the collaboration that we have to work with the respective contractor once onboarded. There are a number of critical items. Obviously, in a build like this being so technical and so time sensitive, any slippage of one component could in fact have an effect on another key piece. So it's really integral to make sure that once the contract is executed, now, like I said, successfully executed, we won't know that until we open the bids, that once it is executed, to make sure that we put all of the provisions in place, not only to ensure the contractor meets the deadline, that we do our part as a government, as the entity that's providing ultimately the payment for the services to be rendered, to make sure that they are, can deliver as we request.
Very well, thank you. And Interim CEO Williams, in respect to the opening of JFL, the CMU building is only other pending issue at this time preventing the opening of JFL North.
It is the longest lead project that would take the longest to complete. There are other projects like the movement of the propane tank away from the building. There are some IT stuff that we still need to complete, but those are not anticipated to take as long as that CMU completion.
And obviously, I'm hoping that there's a parallel discussion being had, or whatever procurement is required to ensure that this is being done within the 9 months. That's where we're hoping that the CMU building will be completed.
Absolutely. So every week we host meetings with external stakeholders, and we have an internal meeting every week to discuss any completion projects that will affect the final opening of JFL North. And we're concurrently working on all things internal operations. It's not just about the physical construction and the completion of those projects. It's really about transitioning an entire functional hospital system into JFL North, and it's inclusive of patient touch, revenue cycle, supply chain management, and all things hospital operations. So those meetings are ongoing.
2 minutes.
What about this budget give you reason for concerns, give you reason for pause?
I think there are always time constraints, understanding that these are federal recovery projects, and they require a very specific way of approaching it so that we're managing those federal resources appropriately in the event that we're ever audited. And so the time that it takes to be thorough and complete doesn't necessarily loan to being agile. Funding, of course, and personnel, as we have shared, personnel will always serve as a risk to our ultimate success, only because we do lack the scope or the breadth of on-island talent, and we're often reliant on having to import talent for all aspects of managing a general hospital.
Thank you. And Ms. Moorhead, in regards to uncompensated care, well, what is the cost of uncompensated care at this time? What's the number that you have pegged to uncompensated care at this time?
Currently for fiscal year 20, we were at $26.2 million.
So what else accounts for your outstanding debt besides obviously the uncompensated care is covered over portion of it by this body, but what else accounts for your outstanding debt?
Well, to be clear, total uncompensated care is $47.4 million. This body appropriates $23.5 million, and that's how I got the 26.2. I just wanted to clarify that. But
that's good clarity.
Yeah.
Okay. Go ahead. So proceed.
In terms of what else leads to the debt of JFO?
Yes.
Really and truly, it's just high expenses. Everything we have to kind of import or fly in, that's all going to lead to us having a really high expenses. And then ultimately, as Ms. Isia Williams stated, it's the reimbursement rates that we get from the payers.
Very well. And do you have any pending litigation or judgment against the hospital at this time? And is it part of this budget?
I will let Chief Legal Counsel respond.
Time.
Attorney Thomas?
Thank you, Senator. Good morning.
Counsel?
Good afternoon, Senator. Thank you for your question. Good afternoon, Siobhan Thomas. Can you hear me?
Yes, we can. Proceed.
Okay, great. Thank you. So yes, we have some judgments that are pending against.
Yeah, you're breaking up. Can you get a little bit closer to your device?
Is that better?
Go ahead and try it.
Okay, good afternoon. Sound check again, Attorney Siobhan Thomas. Yes, so we absolutely do have litigation pending against JFL. There are several matters that are pending, whether they be labor-related medically related civil cases, employment cases. So there's quite a few litigation that's pending before the hospital. And yes, also there have been judgments. So for those, we do have payment plans that we're working to pay those off.
Is any of that part of this budget in terms of what that cost look like, what the number is, CFO?
So any plans that we've already determined, yes, they are. Anything outside of that that has not been finalized as yet, no.
Okay. Mr. Chair, if I could just wrap up with one final.
Yes, you may. Go ahead.
Thank you. So dialysis care is one of those issues that continue to surface, ICEO, and I want you to take the opportunity, as we have had ongoing discussion in regards to the dialysis care, and if you could just kind of put on the record, what's being done to address that, and what improvement as we moved into the GFL North and beyond is being planned for dialysis patients.
Absolutely, and so thank you so much for that opportunity. And so as a portion of the recovery project here on St. Croix, we did have modular units that were brought in, much like the General Hospital of JFL North, to support outpatient dialysis services. We maintained CMS certification the entire time that services were rendered in those modular solutions. In February of 2019, CMS, the regulatory oversight, determined they were no longer going to extend certifications in those modular resources. As such, they required that we transitioned into a brick and mortar solution. And at that time, the territory board did solicit for a public RFP. There were 2 respondents, one being a local one on island, and they're currently working on finalizing that contract to transition outpatient dialysis services to a brick and mortar solution.
Thank you very much, and again, we appreciate the work that continue to happen at JFL. Some of it we wish was faster, but nonetheless, we know that there is some hardworking individuals there, and we really want to recognize them for their commitment. Thank you very much for the opportunity, Mr. Chairman.
Thank you, Senator Francis. Attorney Thomas, what's your target date to finalize that contract for dialysis? It's been out there for a while.
Senator, could you repeat what is the my target date to finalize the contract for?
Dialysis.
So I understand that the board's legal counsel is the one that is working on that contract. I did have some input early in the process, but not in the past 2-3 weeks or so. My understanding is that the target date for the board is hopefully July. However, I don't have control of that, Senator.
Senator, I do, if I may,
Yes,
I do understand that the final contract is in its final versions of being completed, and we do anticipate in another week or so completing that document.
Okay, because the selection was when, 2 months ago, 2.5 months ago?
Yes, sir.
Okay, and CMS told us, give us a stop order, what, 4 or 5 months?
In February
February
of last year.
of last year.
Yes, sir.
Okay, so it's time for the board to execute that contract. You made a decision. You need to move forward your decision, or I can't understand how you make a decision and then you take months in order to execute a contract when we know that CMS have already made their decision. So I think we need to fast track that. Senator James, I give you 2 minutes.
Thank you, Mr. Chair. It was referenced that your team is working to reduce the millions of healthcare dollars leaving the island of St. Croix, and you projected at approximately you will be able to decrease off-island transfers by approximately 25%. I'm not sure if you touched on it, but if you could just elaborate and explain to us how you plan to do so.
Absolutely. And so in healthcare, data drives determination. And essentially, the information from our emergency department indicates that a high volume of our patients are transferred out of the territory for interventional cardiology and trauma. And so as recent as right now, we actually have a technician from Philips, who is the vendor for our cardiac cath lab, doing an on-site assessment, hence why my chief operating officer is not here with us in the chamber, and really assessing the viability of those resources. And so if we can reinvigorate the cardiac cath lab, we do anticipate now not having to send persons out of the territory for interventional cardiology. And so as we discussed, on average, when you transition persons for off-island care at a tune of 1 or 2 every day, every other day, we're anticipating reducing that amount by maybe 1 or 2 a week.
1 minute.
Separate and aside from that, we have been able to onboard additional physicians with different specialties, specifically the vascular surgeon, who also can do trauma. And again, we're looking at the data and we're recognizing that a high volume of our off-island transfers are GSWs or MVAs, which is motor vehicle accidents. And so with the advent of physicians that have various specialties, we are less likely to have to off-island evacuate our Virgin Islanders for treatment when we now can provide that care here.
Thank you for that explanation, and I'm hoping with the approval of the proposed budget before us, you will have the resources to be able to implement that decrease in 25%, right?
Absolutely. And actually, the 33rd legislature, I know Senator Villalay was instrumental in even paying that vendor the $800,000 for cardiac services, anticipating that we would now be able to reinvigorate the VICC. And so it has been some time that we've been working towards that goal, and we're closer to completion.
And my last question, you said for fiscal year 2022, you're working towards the operating rooms. You're going from 1 operating room to, I think, 3 now?
We currently have 3. We were successful in doing that in March of last year.
I'm not sure if I overlook it, but with the 2 others coming online, the 2 operating rooms coming online, how much more revenues we will be expecting in the FY 2022 budget?
So we're expecting, or we anticipate, that each individual operating room could potentially bring us about $1 million of revenue per month. So we're expecting that to be towards that.
Awesome, and I just want to say thank you for your explanation, because I really want to see the profit and loss numbers go down. So that's why I want to see those revenues come in and the decrease in off-island travel so the money could stay here so we can deal with the deficit. Thank you, Mr. Chair, for the time.
Thank you, Senator James. The staffing for the operating rooms, you have sufficient?
No, that is something, we actually have 2 OR teams, the equivalent of 2 OR teams on FMLA, which is highly unusual. And so we've actually worked with it.
Wait, start again.
And so, unfortunately, we've actually had a recent experience. I don't know if it's the timing of the universe. We've had persons with extended leave because of a broken foot or back injury. Or new onset of chronic long-term illness. And it happened all at the same time. And so we're really working to backfill that loss, because quite frankly, they're still on our payroll and we're still obligated because they're an FMLA. But at the same time, we need to continue operations. And so we're working with an agency that we owe well over $500,000 right now to provide more immediate staff. Part of the longer term initiative is, of course, to train some of that staff internally. And so we're looking at addressing our challenges in parallel, because it's not one-stop solution for all crises.
And how long have these individuals been on the FMLA?
I will defer to the chief of HR, the acting chief of HR. It's not the same for each employee.
Correct.
Yes.
I would say that the cluster of leave.
The longest is how much, the shortest is how much?
I would say the shortest should be about 2 weeks. The longest should be about a month.
You have
More than a month.
Do you have an expected return date for these individuals?
Various yes.
Okay, so how many teams do we have now that are actually working? 1, 2 surgical teams?
So we should be down to one full team.
So we just have one full team?
Not enough. You need a
Right.
full team and you need an on-call team.
So one full team doesn't make a difference how many operating rooms we have because you just have one
Absolutely.
team, so you can only use one room.
Absolutely.
So opening that defeats the purpose. Pafford still have a contract with the Department of Health and working with the hospital or ICU?
Yes.
So
We have reached out to the Commissioner of Health for additional support of Pafford staffing to kind of close the gap until we're able to onboard or train additional individuals.
What has been the response?
It has been affirmative. She is actually supportive of us utilizing Pafford to supplement our operating rooms.
So we expect to get that done by when, to get the next operating room staff?
I don't have a definitive time unless you've got a recent update, Ms.
the Pafford team is working on supporting us with our critical hires.
Have they given you a date?
No.
How close are we to an intervention cardiologist being signing on the dotted line to return to the Virgin Islands or to provide services for the Virgin Islands?
So we currently actually have a proposal by an interventional cardiologist that has a large interest in returning to the Virgin Islands. But for us to effectuate that contract, we have to make sure that the cardiac cath lab is viable, and that's the work that the vendor is actually doing on campus today. And then we also have to look at supplies and making sure.
So you have to make sure that the equipment is working.
Yes, because it has been offline since 2016.
Okay, and the carrier will give you an answer. Not the carrier, the company will give you an answer by when in reference to the equipment?
They're giving us feedback in real time, and they're also giving us perhaps considerations to changing the equipment altogether to new updated equipment. And so whether it be a repair or a reinvigoration or replacement, that information should be forthcoming.
Do you have target dates?
Since they're doing the work as we speak, no, we do not have a target date at this moment.
Okay. And having an intervention cardiologist would mean that we can now go back to doing stents and pacemakers, et cetera, and they won't have to be sent off island?
Yes and no. I did have a request from a cardiologist to do an install and a replacement of someone who actually has a current pacemaker in our operating room. And so there may be a modicum of interventional cardiac services that may be able to be provided in our current OR, but the breadth of cardiac intervention would require the support of a cath lab.
How many surgeons do we presently have?
I don't have a count of, I know I have approximately 29 physicians, but I couldn't tell you how many are interventionalists versus
No, surgeons.
10 or so with varying specialties.
Okay. Are you having discussion with an individual who was formerly here that specialized in trauma? Are you still having discussion or that fell through?
So no, we are always engaged with any of our surgeons that have history here on St. Croix. And so there is one in specific that we're not only interested in for trauma, but training of our critical care staff. And that individual has long since shared with us that there is an interest in returning, not just themselves, but other partners within the trauma environment. And we've also been able to successfully onboard a full-time ICU intensivist and, of course, expand our ER. So it's not just a trauma surgeon. It is all the facets that support from the emergency room to the OR to the ICU till discharge. So we're working on all fronts.
There are 12 surgeons.
In total.
Okay, thank you so much. Senator Blyden, you had a point.
Yeah, thank you, Mr. Chair. My point was to the 25% that my colleague spoke to. What does that number represent in dollars and cents?
So we're not able to really calculate the cost well, not the cost, the potential revenue loss, because we don't know once the patient leaves what are the services that that patient receives. We don't have that information. But one thing that we are working on to be able to capture that is with the new health information exchange that the government as a whole is working to, we should be able to capture some of that information.
Okay, very well. And Ms. Williams, congratulations on the first state-of-the-art total hip, knee, and shoulder joint replacement program that has actually brought in profits of $207,000.
Thank you, sir.
He also spoke in the testimony to other services, the clinical line expansion, vascular surgeon to assist in that area. Have you done an analysis to see how much profit we can realize from that space in that area?
I don't know that we have a hard number to date because I know certainly for dialysis services, I believe in the beginning with the initial portion of the engagement, he completed 12 vascular access. And so we can certainly provide you with hard numbers upon further analysis.
Okay, great. Also, in the testimony, you spoke to 3 new revenue streams. And I must say, like I said earlier, you are doing what needs to be done in terms of trying to find creative ways and other ways of bringing in new revenues to the hospital in order to provide the care necessary. It spoke to telehealth. You spoke to primary health wellness program. And I believe you spoke to the cardiac center. Total, with all 3 areas, what we're talking about 11 plus $11 million in new revenues that we can see as a result of that.
We're actually looking at potentially 16 million.
$16 million.
Projected.
Projected, yes.
Okay. Let's speak to the telehealth before my time is called. You said 1.3 potential revenue for the telehealth. By then you should have the infrastructure and everything in place for that?
Yes, the goal is to, by the beginning of fiscal year 2022, to have what's needed to move forward with telehealth.
Okay. And the cash collection, you have a chart on page 11 of 19 of the testimony showing where you are at 34% in 2017, and now you're up to 35%. So you're basically rebounding and going back on an upward trend. I pray that continues moving forward with all of the different procedures that are put in place, the hiring, the training, the extra staffing, etc. So I look forward to JFL moving in a positive direction from 22 forward. And thank you again, Mr. Chair, for the time.
Thank you, sir.
Thank you so much, Senator James. Senator Blyden, I'm sorry. Senator Carong, you have any questions? You got?
Thank you, Mr. Chair.
2 minutes.
Yes. With regards to your budget, I was curious. I wanted to know if you do internal budgets for each department. And if you do, are you having those conversations with the heads of those departments? Do they provide feedback of the budget that is assigned to them internally?
So we do not have currently departmental budgets. That's actually something that we're working towards. But we do have, monthly profit and loss statements that's sent to the chiefs of the individual departments, and so that they can really look and analyze and manage their departments appropriately.
So they receive monthly reports?
Yes.
Okay. But they don't provide feedback on what budget is assigned to their departments or areas or units?
No, in order to develop the budget, I look at expenses overall until we're able to really formulate departmental budgets.
Interesting. I guess my position is maybe departments head should have an input in the budget that is assigned to them, and maybe also be able to share what their needs in their unit or departments are. And maybe to ensure that they're receiving maybe the supplies that they need and everything that they require to perform and carry out their work. So it's interesting the way how you're managing that area. Now, with regards to your revenues, just to have a clear picture of the level of revenue impact that you have received, what were you generating before the hurricanes? I know things changed after we had Irma Maria. What were those numbers before compared to what they are now? Because first we had the hurricane, then we had the pandemic. So just paint a picture of what's the level of impact that JFL is receiving or has at the moment.
Sure. So if we look at net bills for fiscal year 17, which is technically prior to the storm, we were actually at 121.4 million compared to where we are today. And this is, of course, that was for the full year. Today we're at $78.8 million.
Clearly. All right. Thank you, Mr. Chair.
Thank you, Senator Carrion. Senator Francis?
Thank you, Mr. Chair. ICO Williams, in regards to those individuals that's being airlifted or transferred off island, have you been able to glean what is the medical care that required for them to go off island? Is there any commonality in the type of care that you're seeing that you can speak to?
And so the vast majority of persons require neurological intervention, cardiac intervention, and general surgery intervention.
And how are you staffing up to be able to, again, counteract some of that and be able to handle some of those cases? Because time is of the essence.
Absolutely.
And despite having to send them off island, I'm sure if we had those medical professionals here, again, it'll minimize the impact. How are you staffing up to be able to address that?
And so staffing has to do with not just the numbers, but the specialty.
Correct.
And so we've looked at specialists, physician specialists in the area of emergency medicine, our operating rooms specific to our surgery departments, and our ICU, where we do the bulk of the management of those patients that present to the emergency department. And it also has to do with perhaps providing additional training and mock codes, if you will, or for our support staff. So all things from our registered nurses to our respiratory therapists, and all the allied health positions that support the care of a patient when they present to the emergency department.
And do you have someone that's collecting this data and doing an analysis in terms of the demographics involved with this, the environment, locations? Is there any deep dive in terms of the impact and illness that you're seeing?
And so monthly, we do have an opportunity to present to our district board through our performance improvement committee all the data within our IT systems from our emergency department, our radiology department, our lab, our pharmacy, and we look at the volume and the data analysis and really share with the governance of the organization what our needs are based on analysis of the actual data. And that's a monthly ongoing requirement.
Time.
Is there, Mr. Chair, if I could just wrap up, is there an opportunity for you to be able to put that at some point on a database or website that the public will be able to glean from that information was transparent?
Absolutely. And so our website is somewhat outdated. And so that's actually a current engagement where we have a web developer that is working on 2 of our web platforms to refresh our current JFL, but also Practice in Paradise is a workforce initiative where we highlight not just JFL as a hospital, but St. Croix as a community. And so persons who may have an interest in joining our team really gets kind of a pulse check in terms of what we have to offer. And we do anticipate having those websites available within the next 2 or 3 months.
Okay, and my final question, Mr. Chair, is in regards to CMA, CNA, and LPNs. What's that population right now?
And so I will defer to Ms. Lynch.
So currently, we don't have any CNAs at JFL. We have, and I'm going to give you an approximate number. If, from my recollection, I think we have 30-something plus CMAs, medical assistants, and currently on the roster, we have 4 LPNs.
4 LPNs. And you see an opportunity for us to have additional CMAs and LPNs?
As we continue to move forward, yes.
Very well.
in different capacities, yes.
Thank you. Thank you, Mr. Chair, for the time.
Thank you. Thank you, Senator Francis. Do we have a public relations officer?
We are currently recruiting for that position. The vacancy has been posted, and we've gotten quite a bit of profiles that have applied.
Targeted date to bring somebody on board?
At the completion between interviewing and bringing them on board, I would say 30 days
From today?
from today.
Mr. Smalls, you'll be receiving those contracts tomorrow. What's the window you're giving yourself for review of the contracts and selection of a particular company?
Good afternoon, Senator. We're giving ourselves a window of 1 week, but obviously it's really dependent on the number of responses that we have. So, that's just a range, a high number. But obviously, once we get the bids in, or the number of bids, and determine how many are responsive, then that way we could determine how many we actually have to review.
Okay, thank you so much. I guess I'll text you on Friday to find out how many companies responded and if the 1 week still is a targeted date. Is there any
With all due respect, Senator, just going to say, with all due respect, Senator, you'll be contacting the chair of our procurement for JFL, Ms. Rochelle Lewis, as she will be the only one who could respond or answer any questions relative to the procurement process.
Okay,
Just needed to put that on record.
I will need to get the chair number from the CEO so I can get in contact with the chair.
Yes, sir.
There are employees that you're getting from PAFA. When they come to the hospital, are they falling under your supervision?
Yes, because ultimately anyone that works within our organization has to follow all our policies and procedures, but they are supplied to us from the Department of Health.
So there's a process with HR, documentation where they have to follow X, Y, and Z. They have to adhere to all of the rules and regs. They got to follow the punching in, punching out, and not coming when they want.
Yes.
There's accountability measures in place.
Yes, they, like any other employee, even though the contract originates with the Department of Health, they are onboarded through the HR process that applies to all employees at JFL, and they're held to all of the expectations of our policies and code of conduct, professionalism, et cetera, et cetera.
And I will share, just as an aside, Senator, that we have had an occasion to separate 1 or 2 persons in the past. So we absolutely take our responsibilities seriously in terms of holding persons accountable that work under our roof.
So you have an account for the time and attendance?
Yes.
Okay. Okay, interim CEO Williams, I think we have concluded with all of our questions. I'm going to Senator, he's not there. Senator DeGraff is there? I don't think he is.
Yes, Mr. Chair.
You had any other questions, sir?
I just have 2.
Go ahead.
In regards to the LEOs, the law enforcement officers, are they full-time or part-time?
They would be full-time JFL employees.
No, points of clarification, our LEOs are part-time employees.
You mean the contract employees or the newly?
No, contract. Okay, so the total that the post auditor is in the post auditor report, 51 total security.
Those are part-time employees.
51 are part-time?
Yes, they are.
Okay, now that they're part-time, how much law enforcement officers are in contract?
We don't have any LEOs currently on contract. Let me point a clarification. When we began, that was a correction that we needed to make to our HR process. So at the beginning of their hire at JFL previous to 2018, all of the law enforcement officers / peace officers that were hired by JFL, they were on contracts. When we inherited our tenure in 2018, we made the correction and they were transferred to part-time status.
Oh, okay. So they're presently on part-time. Okay, that's one. And do you have any new hires that are any specialty physicians?
Yes, we do.
Okay, what specialties are those?
As mentioned earlier, we onboarded a vascular surgeon. We have neonatology.
An ICU intensivist.
And an ICU intensivist, thank you.
Okay, and finally, I think it was mentioned in regards to the presumptive eligibility, some program that you have where you give out gift cards. Could you explain to me how that program works, please?
Sure. So when a patient comes through the ED and they're deemed presumptively eligible, we do give them, we alert them that if they are able to bring back their full Medicaid card showing that they've been fully converted and have coverage, that we'll give them a $50 gift card.
And how much have you expended thus far?
So we actually received a donation of about 2,000 gift cards, and we've been able to give out all 20 of them. And we have another donation coming.
You could go ahead, complete.
Yeah, I was just following up to say that we do have another donation that we've received with more gift cards to hand out as well.
Okay, thank you for that. Thank you for the time, Mr. Chair.
Thank you, Senator DeGraff. Point of inquiry. Senator Francis.
Real quick, in regards to individual that comes in with a gunshot injury, and you work on them, perhaps they have to be airlifted, and there's an expiration of that individual or they're demised. Who ultimately will be responsible for processing their what will be considered the uncompensated care? Who will handle that process? Who will fill out the necessary documentation to make sure that the hospital is made whole?
So we would try to get as much information from the patient as we can without, of course, affecting the quality care. After that point, we would then have to reach out to family to try to assist in getting us information so we can bill appropriately. JFO.
But to your point, Senator, that actually adds largely to our uncompensated care costs after we've exhausted every other provisions to collect.
Thank you so much. I think we have exhausted all our questions for GFL, so I'm going to allow you to put a closing statement on the record.
Thank you, Senator. I would like to first thank the members of the 34th Legislature, the Committee of Finance, and the Honorable Senator Kurt Fiele for the opportunity to present our budget testimony today. JFL has major success despite our ongoing challenges, and we thank this body for remaining committed to the people of St. Croix by standing in the gap whenever we have reached out for support from this committee. I would like to leave you with the full knowledge that this executive team remains committed to the mission of advancing the health care of the people of St. Croix and this territory. We continue to do the work of the people. We have a great once-in-a-lifetime opportunity to advance the provision of health care for St. Croix. We have long maintained that JFL is an anchor institution that attracts highly skilled, highly educated talent, can increase our economic base, and attract businesses and residents to our shores. Finally, I can't overstate enough that the lack of parity with reimbursements of our federal payers as compared to our commercial payers for the past 2.5 decades will never allow us to, as an acute care facility of the territory, to become economically viable unless changes are made. As we testify today, 75% of our reimbursements for services rendered are dependent on our federal reimbursements. And the last 2 decades have shown that our uncompensated care rates will continue to balloon until we address this critical issue. We need to change our reimbursement models. Coupled with the significant time it takes to petition and receive the returns of our cost audit reports, makes our financial challenges much more unsustainable. JFL remains insolvent and will remain largely dependent on central government until we make those critical changes. We need this body and other members of the 34th Legislature to support H.R. 3434, the Territories Health Parity Act. Lastly, we often think of JFL and its leadership as a focal point of our hospital, and in some instances, that's absolutely true. However, the fact of the matter is, JFL is a family of over 500 employees that serve the healthcare needs of this community, and we can't deliver the care that our community deserves without them. Our team members are our superheroes, and we all stand JFL strong. We remain thankful for our frontline essential workers, for without them, none of the work of the executive team can be realized. We thank them for their continued dedication and their hard work as they stay on mission to rebuild today for a healthier tomorrow. Today, already, you, Senator Villalay, and your Senate colleagues have demonstrated leadership by ensuring that external agencies address their debt to JFL. We thank you and stand ready to implement. The executive team and I thank you for the opportunity to testify today and the committee's continued commitment to supporting JFL. Thank you.
Thank you, CEO Williams. I also want to thank all individuals who work at the Juan F. Louis Hospital. We thank you for your service to the Virgin Islands. This committee will be in recess until 1:30. The Committee on Finance is back on the record. Madam Clerk, can you read the next item on the agenda?
Frederiksted Healthcare, Inc. Invited testifiers, Masseray Sproul Webster, Chief Executive Officer.
Thank you, Madam Clerk. Ms. Sproul-Webster, can you put your name and title on the record, and then everyone, just one person? Just two of you? Okay, so both put your name and title on the record.
Masire Sproul Webster, Chief Executive Officer, Frederiksted Healthcare.
Jacqueline Reimer George, Chief Financial Officer.
Thank you so much. Ms. Webster, you may proceed with your testimony.
Thank you. And good afternoon, Honorable Senator Kurt Viale, Chairman of the Committee on Finance, other committee members, all other senators, and our listening and viewing audience. I am Masire Sproul Webster. I am the Chief Executive Officer of Frederiksted Healthcare, otherwise referred to as FHC. I'm here to testify on behalf of the Board of Directors of Frederiksted Healthcare, our staff, and our patients. With me today is Ms. Jacqueline Reimer George. She is the Chief Financial Officer of Frederiksted Healthcare. Ms. George has been the CFO at the agency for the past 19 years, and she will assist me in responding to any questions that you may pose. We thank you for the opportunity to update you on the accomplishments of FHC over the past year and on the challenges that we face in the upcoming year. Frederiksted Healthcare is a nonprofit organization which was created in 2000 to provide primary care services on St. Croix and is a community health center funded under Section 330 of the Public Health Service Act. We have grown much over the past 21 years, from 26 employees and a single location in Frederiksted to 160 employees and 6 locations across St. Croix. FHC provides health services to everyone, regardless of economic levels. The vast majority of our patients are underserved by the traditional healthcare system. As a community health center, we are required to operate in a manner such that no patient is ever denied services due to the inability to pay. We offer services using a sliding fee schedule, which provides discounts to individuals with income at or below 200% of the poverty level. This equates to about $25,000 per individual per year. This ensures those individuals have access to care. Our mission is to provide non-discriminatory, evidence-based, affordable, and accessible health care to the community of St. Croix. At FHC, we often reflect on the last phrase of our mission statement, the community of St. Croix. FHC is an integral part of the community of St. Croix, and we take our responsibility to serve the community to heart, as is indicated in our mission statement. We were happy to host the Committee on Health and Human Services on a tour of our location in May to help the legislature visualize our commitment across our community. A constant refrain heard during this tour was, "I didn't know that you had all these locations. I didn't know you provided all of these services." I invite you to dialogue with your colleagues so they may share the insights they gathered as they visited our sites. The Health Center program requires our board to be members of the community and for the majority of board members to be patients of the Health Center. This ensures operations are both community-based and patient-oriented. This uniquely qualifies them to provide oversight of operations, as well as to conduct strategic planning, which is responsive to the needs of our community. As I prepared my remarks for today, I spent time reflecting on the events of 2020 and was reminded of the sentiments of optimism as the new decade began, and quickly moved to disaster as the COVID-19 pandemic emerged, impacting both healthcare and our economy. Throughout this difficult time, our community worked together to minimize transmission and deaths, and we would like to thank the Department of Health, our hospitals, other medical providers, and our entire community for the work we have all done to keep our infection rates and death rate low. Even in the face of this unprecedented disaster, we found 2020 was full of accomplishments for FHC, and we'd like to share a few with you. In 2020, FHC provided care to 9,231 unduplicated individuals at 28,803 encounters. 98% of these patients had income below 200% of the federal poverty guidelines. For a single individual, as I shared, this is $25,000 per year or less. This is less than $500 per week to cover food and housing and clothes and transportation and medicine, and the list goes on. 74% of these patients were African Caribbean, 20% were Hispanic, and 6% Caucasian. Within our patient population, there were several subpopulations of individuals who are even more vulnerable, including 87 individuals who are being treated for HIV and AIDS, 80 individuals who are chronically homeless. Frederiksted Healthcare is known to be a safe and welcoming environment for all, including these marginalized groups. Most proudly, we provide prenatal care to 200 women who gave birth to the next generation of Crucians. This represents about half of the births on our island, as the hospital reported 400 births for 2020. It is our honor and our responsibility to provide care to the most vulnerable among us. Never in our lifetimes have any of us faced such a challenge as a global COVID-19 pandemic. Yet, we at FHC count our response as our biggest accomplishment in 2020 and arguably in our entire existence as an organization. Please allow me to take a minute to express how proud we are at FHC for our staff and their families. Although we took every safety precaution available to us, there can be no doubt that our staff placed themselves at risk for infection simply by showing up for work every day. And yet, they continued and still continue to do just that. Even as members of our team were diagnosed with COVID-19, our staff continued to come to work and continued to place themselves at risk. As essential healthcare workers, we take our mission seriously. However, we never expected to be in such a position. As members of the St. Croix community, our team rose to the challenge, and we thank them immensely for their dedication and commitment to our community. As soon as tests for COVID-19 became available, we initiated testing of staff and their families. Our next steps were to offer testing to public service personnel, including other healthcare providers, fire, police, social services, corrections, public works, staff in the hotel industry, and so forth. When supplies became readily available, we began testing anyone who requested COVID-19 testing and continue that practice today. When the vaccines became available in December, FHC worked closely with the Virgin Islands Department of Health to administer vaccines to our community. FHC was among the first community health centers in the United States and the only community health center in the territory to receive a direct allotment of vaccines, increasing the total availability of vaccines in the Virgin Islands. FHC continues to work diligently with other community partners to vaccinate our community in efforts to attain herd immunity in our community. During the pandemic, FHC has been blessed with much support from the St. Croix community at large. With donations and notes of gratitude, these efforts of support have encouraged us to go the extra mile for our patients. We thank all who have donated or sent notes of gratitude for your support of FHC. As we transition back to normal and visitors return to our island, we must all be more vigilant, and practicing proper safety measures is even more important. We must realize that COVID-19 is non-discriminatory. We cannot afford to let our guard down. Allow me to take this opportunity to encourage the public to continue to practice social distancing, Wear masks in public and wash or sanitize your hands often. We cannot emphasize enough that we must all be vigilant in this fight against the spread of COVID-19. In January 2021, we opened our newest location in the Mall of St. Croix, the Lena Schulterbrandt Community Health Center. Our research indicates that transportation is a major barrier to care on St. Croix. Locating services in the areas of high need is the most effective way to increase the numbers of people who access the services. We named this health center in honor of educator, community activist, and longtime FHC board member, Lena Schulterbrandt, who I'm certain many of you remember fondly. This new site includes 7 medical exam rooms and a laboratory. The board of directors made the commitment to this expansion by investing funds derived from program income to renovate and staff this location. No new funding from the Virgin Islands government or the federal government was received to open this site. This new location will expand our services and remove barriers to care for individuals who live in this part of our community. FHC recently received Patient-Centered Medical Home, or PCMH, designation from the National Committee on Quality Improvement for 3 of our health centers, being Abogue Nesbitt, the Mid-Island, and the North Shore site. This designation is a testament to our dedication to providing services that focus on the needs of our patients. PCMH designation requires documentation of systems that ensure team-based care, a deep knowledge of the needs of our patients, access and continuity of care, case management of high-risk patients, coordination of care across the healthcare system, and ongoing measurements of performance and quality improvement. FHC's 3 locations are the only designated patient-centered medical homes in the Virgin Islands. Work to obtain PCMH designation began prior to implementing services at the Lena Schulterbrandt Health Center. And thus, we intend to obtain PCMH designation for that location in 2022. Frederiksted Healthcare also received awards from the federal government for reducing health disparities in minority populations and in improving access to care. FHC first received malpractice coverage under the Federal Tort Claims Act during 2020. This coverage is provided by the federal government following demonstration of risk management, quality improvement, credentialing, privileging, and claims management processes. The designation requires annual updates, and FHC recently received coverage through the end of 2022. There are many more accomplishments during 2020, ranging from expanding telehealth services to the purchase of a new data analytics package, to better track operations, patient outcomes, and to support quality improvement. While too many to mention here, rest assured, FHC is determined to provide the best care possible, and we will continue to work to improve the lives of our patients through improved health. We would be remiss if we shared only our accomplishments and failed to point out the challenges which we continue to face. We continue to face the overwhelming needs for services on St. Croix. In 2020, FHC completed a comprehensive needs assessment to guide us in strategic planning. This needs assessment found there continued to be over 12,000 low-income individuals without access to primary care services on St. Croix, and that life expectancy is 2.3 years lower than in the United States for women and 6.6 years lower than in the United States for men. The leading causes or chronic diseases which can be positively impacted by primary care, such as heart disease and diabetes, as well as conditions which have better outcomes with early detection and prevention, such as prostate cancer, colorectal cancer, lung cancer, and breast cancer. We must do more to bring those who do not receive regular health care services into care to reduce this disparity in life expectancy. The addition of the Lena Schulterbrandt Health Center was another step in the right direction, but more remains to be done. According to the Health Resources and Services Administration, more than 60% of the individuals on the western end of St. Croix live below 200% of the federal poverty guidelines, and more than 50% of individuals on the eastern end of St. Croix live below 200% of the federal poverty guidelines. It is clear that no part of our island is immune to the impacts of poverty, and our locations are strategically located to improve access across our island. As a result, about 1/3 of our patients are from Frederiksted, 1/3 from Christiansted, and 1/3 are from Kings Hill. Oral health remains a major concern for our patients. In a 2016 survey by the Center for Disease Control and Prevention, 49% of adults in the U.S. Virgin Islands indicated they had not seen a dentist in the prior year. FHC is the only safety net dental provider on the island of St. Croix, and the only dental provider available for patients covered by Medicaid. Currently, FHC has 14 dental operatories across 3 locations, the Ingeborg-Nesbit, our Dental East, and our North Shore Health Centers. We are currently making improvements and expanding our dental operations at Ingeborg-Nesbit. Funding has been received from HRSA to add 3 additional operatories at the Lena Schulterbrandt location, which we project we will have open in 2022. As we seek to expand the number of individuals who are in care, we are mindful of the difficulty that low-income individuals face when traveling across St. Croix, and we expect to take delivery of a mobile van this year, which will include an examination table that is suitable for both medical and dental services. We will use this van to take services directly to our most vulnerable and hard-to-reach patients. The global COVID-19 pandemic continues to challenge operations. Ongoing need for testing, pursuit of herd immunity through immunization, and the needs of patients who suffer ongoing medical issues due to COVID are all part of the equation we are attempting to balance at FHC. Perhaps the most urgent need we face resulting from the COVID-19 pandemic is bringing individuals back into care who avoided care during the acute part of the pandemic and dealing with issues which may since have arisen. For example, I have an educated friend who works in healthcare that avoided preventive services completely during 2020, even though she knew the importance of those services. Now she's fully vaccinated and she's scheduled her mammogram and annual eye exam and dental cleanings this spring, only to find out that she had a breast lump, thankfully benign. She needs cataract surgery and had a tooth abscess requiring a root canal. I share this as many of our patients may find themselves in similar or worse situations, as they may even be further behind in preventive care than my friend due to their lower health literacy levels. We expect these patients to need longer appointments and more services as they return to care. We also expect some patients will continue to be reluctant to return to care and anticipate the need to proactively outreach to these patients. The management of chronic diseases is a major challenge, particularly hypertension and diabetes, both of which contribute significantly to our low life expectancy rates. FHC is currently implementing projects using remote monitoring devices and telehealth to improve control of these potentially debilitating diseases. In 2020, we made a significant investment in new software that works with our electronic health record system to provide us with better access to patient data in real time to support our efforts to improve outcomes. to ongoing care of routine, acute, and chronic conditions and response to the COVID-19 pandemic, we must now add care of individuals with potential exposure to noxious chemicals from uncontrolled releases at the Limetree refinery. We have had patients present with complaints such as headaches, dizziness, poor memory, fatigue, breathing issues, and balance problems, and we are in the process of developing a patient registry so that we can monitor both short and long-term impacts. At Frederiksted Healthcare, we take to heart the motto, no margin, no mission, and we're keenly aware of the need to maintain a healthy bottom line. The economic uncertainty caused by the downturn in economic activity resulting from the COVID-19 pandemic, as well as the current conditions at Limetree Bay, challenges FHC, as we expect to see more and more uninsured patients at our doors. We are proud to shoulder the responsibility of these patients, but we ask you that you be mindful of this responsibility as you consider our budget requests. We understand the Medicaid audit for 2014 to 2016 has been completed, and preliminary findings indicate that FHC was overpaid approximately $1.8 million. As we await the official notification and the invoice, it is our expectation that the overpayments from 2014 to 2016 will be credited against the $4.2 million outstanding, which is still owed to FHC from the 2011 to 2013 audit. This would bring the balance owed to FHC to $2.4 million. Primary care services meet many of the healthcare needs of our patient population, but are alone or insufficient to ensure good health for many of our patients. A robust healthcare system, including specialty and hospital services, is necessary, yet unfortunately is currently lacking on St. Croix due to the deterioration of the physical infrastructure. Many specialty providers left following Hurricanes Irma and Maria, leaving a large gap in available referral services. Our hospital, which once had over 200 beds operational, is down now to less than 50. Patients must seek care off island, and medical evacuation flights are a daily occurrence, which neither our patients nor our Medicaid system can afford. Our primary care providers fill gaps as best as they can, but must practice within the limits of their scope of practice. As we seek to meet the needs of our community, we find workforce issues to be a limiting factor in expanding services. Recruiting and retaining highly qualified healthcare professionals has always been difficult, but has become more so with COVID-19 restrictions. With limits at GFL and the general economic malaise which grips our islands, it is hard to recruit. One of the ways we address this is by maintaining our National Health Service Core Site designation. This allows our providers to apply for student loan repayments in exchange for working at a National Health Service Core Site, and is a powerful recruiting tool. A study done by the University of the Virgin Islands found patients were sometimes uncomfortable with medical providers from the mainland who often have trouble communicating with islanders and do not understand the cultural aspects which impact healthcare. At FHC, we pride ourselves in retaining staff who are connected to our patients and are committed to our mission. Staff turnover at FHC is less than the national average. Our commitment to our employees is evidenced by our recognition by the Employer Support of the Guard and Reserve Above and Beyond award that we recently received. Frederiksted Healthcare was a semifinalist for this award from among over 2,600 nominees nationally. We have provided you with some of our recent accomplishments and shared with you some of our biggest challenges And now we must ask you for your support. We close today by requesting a local funding allotment commensurate with the services we provide and the need on St. Croix. It is our understanding that the current recommendation for funding is in the amount of $2,150,000 for Frederiksted Healthcare. This is a continuation of the current budget, which was reduced in FY 2019 from $2,300,000 to $2,150,000. While we know that the Virgin Islands government faces many competing priorities in the development of the budget, it is our understanding that this amount is proposed for FHC for both 2022 and 2023, while funding for the St. Thomas East End Medical Center is proposed at $2.9 million in 2022 and $3,078,000 in 2023. This seems unfair and unwise. This is more than $1.7 million difference between the two organizations. This poses a great concern to FHC, as we expect at a minimum equity between the two organizations. Both Frederiksted Healthcare and St. Thomas East End Medical Center share a mission to provide care to the most vulnerable in our communities. We are uncomfortable being placed in a position where our two organizations are pitted against each other in a fight for funding. It is irresponsible for the Virgin Islands government to place us in this position. I feel I must share some of this responsibility. For the past several fiscal years, we have submitted extremely conservative budget requests in the amount of $2.5 million in recognition of the tight economic times and limited financial resources of the Virgin Islands government. Each year, our request of $2.5 million was reduced to $2.1 million. Rather than continuing to request more than what appeared to be available, this year we limited our request to $2.1 million for 2022. We were sensitive to the added pressure of the economic downturn due to the COVID-19 pandemic, and now the impact of the closure of Lime Tree Refinery we expect would further reduce the available funds. We did, however, request $2.5 million for 2023, expecting better times. It seems, based on the proposed allotment for St. Thomas East End, that the Virgin Islands government is in a better financial situation than we assumed, and we formally asked for an increased allotment to $2.9 million in 2022 and $3,078,000 in 2023, as is proposed for St. Thomas East End. We do not ask that you decrease funding for St. Thomas East End, but increase funding for FHC to parity with St. Thomas East End. Both organizations served the Virgin Islands admirably during the ongoing COVID-19 crisis, and we continue to provide care to our community. Please consider that while we do not ask for more funding than St. Thomas East End Medical Center, nor do we want you to reduce the allotment for St. Thomas East End, FHC does serve more patients, more uninsured patients, more homeless patients, more school-based patients, more veterans, more medical patients, more dental patients, more patients with hypertension, more patients with diabetes, more patients with HIV. An equal allotment is only reasonable when considering the scope of FHC operations. Sadly, this is not the first time FHC has been placed in a position where we feel we are competing with our sister health center on St. Thomas for available funding. This same situation took place in FY 2019 when disproportionate funding was proposed between FHC and St. Thomas East End, with St. Thomas East End receiving 67% of their retroactive Medicaid funds, while FHC only received 30% of our retro funds. We are attaching a copy of letters that were sent to Governor Bryan and the members of the 33rd Legislature to this testimony regarding the disparities at that time. Upon review, I am sure you will find that little is different now in 2021, and I trust you will reach an equitable solution to this dilemma. We do not ask our allotment as a grant or as a gift, but as payment for the services that we provided, and we remind you that the allotment provided has not kept pace with the level of services we provide in response to the needs of our community. Our allotment was reduced in 2019 by this honorable body due to the increase in the federal share of the Medicaid payments resulting from Hurricanes Irma and Maria, and has remained at the $2,150,000 since 2019. Although we initially received 100% for 2019 from Medicaid, FHC recently had all 2019 Medicaid payments reversed to reflect a federal share of 89%. It seems that the reduction in the allotment by this body was premature. The current allotment represented only about $50 out of a total cost of $352 per visit in 2019. The allotment is not only necessary to compensate FHC for the territory's share of the Medicaid payments, but to assist with uncompensated care for uninsured patients. Last year, 18.6% of our patients were uninsured. This was an increase of 8.7% from 2019. We anticipate this will be over 2,500 patients during the upcoming budget year and at approximately 7,500 unpaid visits. Our budget request for the VI government is critical in providing these services to the most vulnerable in our community. With the closure of the Lime Tree Refinery, the number of uninsured could increase significantly. In the upcoming budget period, Frederiksted Healthcare will include provision for our continued high-quality medical, dental, substance abuse, pharmacy, and enabling services, ongoing operations of our existing 6 service delivery locations, care of an estimated 14,000 unduplicated patients, and an estimated 46,000 visits. We ask you to keep the concept of community in mind as you deliberate your ongoing funding for Frederiksted Healthcare. Our annual allotment from the government of the Virgin Islands is one of the key ingredients that allows us to provide essential services to our community. Without it, our strong financial foundation crumbles and ongoing operations are in jeopardy. Frederiksted Healthcare will leverage these funds by carefully managing our resources to stretch each dollar spent, and will continue to diligently seek grant funding to support services for uninsured individuals and other uncompensated care. Our responsible stewardship of funds is demonstrated by our continued clean financial audits and our continued expansion of sites and services in the face of stagnant local allotments. We look forward to working with this body on our important mission, and Ms. Rima George and I remain poised to answer any questions that you may have.
Thank you so much for your testimony, Ms. Prow. I am confirming as to whether or not the number in the budget book for East End Clinic is actually what is proposed, or whether or not it is a mistake.
I attached a copy. I downloaded it.
I have it from the budget book. But in preliminary discussion, it appears that there's a typo, so I'm going to find out as to what is the proposed amount for Frederiksted. Definitely, it's clear that your operation presently is bigger than the East End Clinic. East End is expanding, but you already have, what, 6 sites?
That's correct.
So I think we always keep that in mind when you come before us. So I'm going to get the factual information. I'll provide it to my colleagues, and then we definitely will make a decision based on what is placed in front of us. As usual, this is a process, it's a budget markup or markdown. We have the process when we sit, and we make the determination as to exactly what we think is fair for the various entities that serve the Virgin Islands. So we're going to make sure that we do that in this particular instance. We'll go to a round of questioning, colleagues. This website is usually very thorough with our presentation. So we're going to go to a 4-minute round, beginning with Senator James.
Good afternoon, testifiers. It's unfortunate that this have to be placed on the record, but I do understand your cry, and I don't know if I will ever live to see this happen when it comes to disparities between St. Thomas and St. Croix comes to an end. However, as far as your justification for an equal allotment, if the allotments are equal, do you already have something factored in as far as what you would do with the cost? Have you done an assessment if we were to move in that direction?
Yes, and we can resubmit our budget. As I shared in my testimony, we are presently renovating a suite at the Mall of St. Croix to add dental services. That we can utilize the funding for the staffing of that dental suite. We also are trying to expand our mental health or behavioral health services. We have been trying to hire a psychiatrist for the longest time, and we have not had enough money to attract a psychiatrist. Between our dental services and expanding our medical service, our behavioral health services, there's always need for extra supplies and equipment. There are items that we have invested in program income that often we could use program income for other advancements. We are interested in building a building at our Princess site to offer social services, to expand our HIV program and services for our homeless here to Christiansted. Right now, those services are limited in Frederiksted, or limited to Frederiksted, the Frederiksted site.
And those list of things that you made mention of, you already have an idea of what that would cost?
I'm saying that could easily go in this 1.7, that's the difference between the two facilities for the 2 years. That can easily go towards sustaining that.
So as you know, the budget process, you're very familiar with it. This is something that was proposed by the executive branch. So did you communicate this with the executive branch before they brought down this proposed budget?
No, we never have the opportunity to discuss it with them. It is only yesterday that I actually saw the what was sent down from OMB, and that's where I saw the difference.
And that is a good thing of the way how this government is structured. We control the purse string, so I'm glad that you brought it to our attention. And hopefully in next time around when we do have these budget hearings, prior to the budget hearings, if you could just communicate that to the OMB and the governor and his team to make sure that we don't have these disparities. And even if there is a disparity, then it's up to this body to determine how we move forward adjusting that.
1 minute.
I see here you have federal funding for $3.5 million. This is page 6 of 9 of the post-audit report. But when that's an exhibit. When I look at one of the exhibits, and then when I look at the next exhibit, I'm seeing a total of $3.8 million. Is this an error, or what's going on there? Page 6 and 7 shows different numbers for federal funding. Or is it something else extra included in the other exhibit on page 7?
On page 7, you see $3,871,000. That's what you're referring to?
Yes, and then on page 6, I'm seeing 3.5. That 3.5 is factoring what is showed in the other exhibit on page 7?
That speaks to personnel. That's the 3.5 speaks to personnel funding.
Okay, just want to make sure I'm seeing right. So
right, the 3.5 that you see on page 6, it speaks to personnel that are funded under the federal funds, and the and on page 7 it speaks to just the total federal funds that we receive. Some of those monies we utilize in buying equipment and supplies.
Time.
No, I'm happy to know that you're receiving federal funds, but between the American Rescue Plan, that was something that was recently passed, if I'm not mistaken. You already have a plan in place of how you're going to expend those funds from the American Rescue Plan?
Yes.
Understood. And last but not least, so I won't abuse my time, the HRSA Rural Health Cluster of $1.9 million. Can you just elaborate for me more of what that entails?
So that is the major federal funding grant that we have. That is the grant that established the health center, the federally qualified health center. That is the largest one we have and the one that we've had the longest. And most of it we utilize for personnel.
Okay, understood. My time was called. I don't want to abuse my time. Thank you, Mr. Chair, for the time.
Thank you, Senator James. Once again, I'm trying to get confirmation and preliminary. I'm not sure. They're going to check the records to see if something was submitted as to why the figures are so off. But preliminary, I'm getting $2,033,000 for East End and $2,300,500 for Frederiksted, based on calculations that OMB were doing with a 7% increase over what was allotted last year. So that's just preliminary. Not saying, I'll get a definitive word, and then no matter what it is, this body still has the authority to mark up or mark down, so we'll definitely have those conversations. Senator.
Excuse me, could you repeat it?
$2,300,500, and East End $2,033,000, based on a 7%.
Thank you.
Okay, now I don't know if Senator DeGraff is still on. Is Senator DeGraff on? If not, Senator DeGraff, I'm going to go to the next senator, and you'll be next after. So, Senator Blyden.
Thank you, Mr. Chair. Good afternoon again to my colleagues. Good afternoon, Director Webster, and thank you so much for your testimony. Let me ask you quickly, despite the numbers being wrong, you still see a need for some type of increase in your budget based on the recent challenges that we're going to face ourselves when it comes to the closing of Lime Tree?
As I was sharing, more than likely that is going to affect many of the employees that work there as far as insurance coverage. We've seen this before. As they lose their jobs, they become uninsured, and they seek care at FHC. Right now, with the sites that we have, all of our schedules are filled. We still see where, we're not meeting the total need that St. Croix has.
Okay. Let me ask you, when it comes to the post out of report, on the independent contractors, you have one in particular when it comes to a dental surgeon.
Mm-hmm.
The rate is $125 an hour. Do you have a amount in terms of how much funds have been extended thus far for 2021?
How much we've spent so far with her?
Yes, with our service, for that service.
So we could bring that up. We can send that back to you. We bring her to St. Croix 1 day a week to see the children with extreme caries. There are many kids here on St. Croix, unfortunately, that have severe caries. And she comes over with an anesthesiologist. And the children are sedated, and she performs surgery on them and removes. And that happens every Monday.
Okay.
So it's 8 hours a day. We could multiply that by 26, which is half the year, give or take, right? And multiply it by 52. But we could get that back to you.
Okay, thank you for that. Also, when it comes to the federal grant, the HRSA Rural Health Cluster, what does that grant encompass?
The term is Health Services Resource Administration. It's a federal branch of the U.S. government, and that is our primary funder for our operations.
Okay, and your leased properties, all of your rental obligations up to date?
Excuse me?
Your leased properties, your rental obligations up to date?
Yes, they are. Yes, they are.
Okay. And I see, how many vacancies do you have? Only one?
I think we have more than one vacancy. We have a couple of vacancies. Maybe you're looking at one grant, but I'm not sure.
No, I know you need a practical nurse, correct?
Excuse me?
Practical nurse?
Yes, we are always looking for nurses.
George, is the vacancies on the local funding that we had. We have other vacancies on our federal and on program income.
So how many vacancies do you have total, local
1 minute.
and federal?
So I don't have that in front of me, but it's something that we can get back to you. I think it's less than about 15 vacancies I think we have listed that's running at Department of Labor and on our websites.
Excuse me?
All of our vacancies are currently on the listing for Department of Labor, and it's also on our sites.
And are they funded vacancies?
Yeah.
Okay. I know you mentioned in your testimony, Ms. Webster, in terms of your turnover rate when it comes to employees, it's less than the national average. Congratulations to that. What do you think has contributed toward that?
I think we are a good place to work. I think I really think we are a good organization. I think our employees are happy there. Our employees, like working at Frederiksted Healthcare.
And the National Health Service Corps, you said you have attained a destination. When it comes to that, what
We
is
are
it?
a National Health Service Corps site. We are a site. We're designated as a National Health Service Corps site. Not every site or not every health center is. And by being that, people can come and work for us and they get student loan repayment.
Time.
Do you know if that occurs in the hospitals also?
Yes, both hospitals are sites. I'm not sure if they're current right now, but they have been National Health Service Corps sites.
Yeah, we have to look into that. It makes sense. Thank you so much for your response. Thank you, Mr. Chair, for the time.
Thank you, Senator Blyden. Senator DeGraff, you're recognized.
Thank you, Mr. Chair. Good afternoon, colleagues. Good afternoon, testifiers. I just wrote down this quote: "We are a good place to work." Thank you for that. For me, what we consider is very simple. If they can be the same, then they go according to who have more and who provided more services. So I agree. St. Thomas, St. John, St. Croix should be parity. So again, you have the issue with me, markup and Yakana. The hospitals earlier was speaking of presumptive eligibility. Do you have that program?
No, we do not.
Okay, so how do you deal with your uncompensated health care?
That is part of why, a part of our lobbying to you in terms of our local allotment.
Okay, so the local allotment is what compensates for that. And with based on the numbers you gave, the increase would, what would a difference, the increase that the numbers you mentioned do for that uncompensated care?
Has looked like?
Excuse me?
Ms. George is going to tell you what our uncompensated care has looked like over the past couple of years.
Okay.
So uncompensated care has turned out to be about 27% of our net revenues, which range from 2.7 to 2.9%. So the allotment definitely helps us to be able to service more patients by hiring more staff and being able to get them into care. And so any additional monies that we have allows us to be able to hire more staff and offer more services.
Okay, great. And again, back to the quote, we're a good place to work. Your employees, I know you're a nonprofit. Tell me how are the employees compensated and when are they due for wage increases, or when last have they received wage increases?
We have a commitment of every 2 years of doing increases. We just recently did increases earlier this year. And I want to change my quote from a good place to an excellent place to work.
Okay, good. I'm going to write that down. We're a great place to work. Okay, so you say every 2 years. So when would be the next wage increase?
So we just did it. April
May
of
20th.
2021, just 2 months ago.
Okay, good. And you see, you have the 19-year employee. I don't know how to put it, but in terms of what is provided for employees who have that kind of tenure in your organization
1
for
minute.
their retirement or anything like that.
Frederiksted Healthcare Inc. does have a retirement plan. We have a 403B plan that's offered through a company called Census, and there is still a couple of us that participate in the GRS plan.
Okay, good. And is it up-to-date payments to GRS plan?
Yes, they are.
We are current on all of our payments.
Okay, good. And like I said, I basically, that's all I had for you. Thank you for what all you do. Continue to do, and you have my full support. Thank you for the time, Mr. Chair, and thank you.
Thank you, Senator DeGraff. In reference to the presumptive eligibility, has there ever been any discussion with Human Services as to how those individuals that don't have a Medicaid card, or you could relay that information and be eligible for presumptive eligibility?
Yes, our outreach workers often hold hands of patients and carry them up and get them enrolled. Some of our staff has been trained to perform presumptive eligibility. However, we have had connectivity problems with connecting to the Medicaid program, our system. So we haven't been able to stand it up, but staff has been trained. And once we get that ironed out, then we can do it at our sites.
Okay, and that connectivity is through Human Services or independent directly to the Medicaid portal?
I think it goes to Department of Human Services, because our process is we certify and get the patients approved, but it still has to be, a final approval still has to be done by Department of Human Services, and they issue the MEP.
Are they aware that you don't have connectivity?
Yes.
And they came up with a time schedule as to when they'll be able to fix a particular problem?
We met up to sometime last month.
How long has this been?
It's been a while.
Okay. And do you have patients that come to Frederiksted Health Center that would qualify for the presumptive eligibility?
We believe so, yes.
Okay.
And as I say, in those cases, especially if the person is homeless, then we're actually taking them to the Medicaid office and helping them get enrolled. We're even using our address, Frederiksted Healthcare address, because you need an address for people that are homeless.
Okay, then we need to get Human Services to deal with this particular problem. We actually have more money than we're spending under this presumptive eligibility, millions more than we're spending. So if we have the ability to add on individuals that you're going to get additional compensation, we need to move in that direction. So colleagues, I think we're going to need to have a very serious conversation with Human Services in reference to those eligibility issues. I know that they have somebody stationed at the hospital, and the hospital also have individuals who are trained, and the system is connected there. So perhaps it wouldn't hurt if one day a week they come down to Frederiksted, go through the records and see who would qualify, and then call those individuals and have them sign up. Senator Francis, Senator DeGraff, you wanted to say something? 1 minute, Senator
Yes,
President.
thank you, Mr. Chair. Just in regards to this conversation, presumptive eligibility, if it's just Human Services or is there anything that FSC need to do in regards to that we'll probably have to do a costing for it. So if on their end, so we could also have that kind of information, so it'd be an easier transition. So,
Okay.
Thank you.
You have the hardware, it's just a program issue. Okay, thank you so much.
Oh, thank you.
Senator Francis.
Thank you very much, Mr. Chair, and good afternoon to you, my colleagues, and of course, good afternoon to the testifiers here from the Frederiksted Health Center. I first of all want to congratulate you on your recognition by the National Committee of Quality Improvement. I think that's a great recognition. Congratulations on that. I too want to thank you for the tours that we have had of your facilities. Very, very impressive. And certainly, I will be a advocate for what you have put on record in regards to ensuring that there is equity, or in instances where there is a need for additional funding, I'll be a good supporter for that, because I truly believe that we're getting the return on the investment when it comes to Frederiksted Health Center. Again, I've been able to do the walkthrough. I've spoken to the individuals. I've seen your providers, at work, and certainly the level of excitement in the work that they provide to this community. And we're talking about those uninsured, the underinsured, the vulnerables, the homeless, the mentally challenged individuals, those that's most needing this type of care. So I will continue to be a strong advocate on your behalf to make sure that we're paying up as best as we can to make sure that we continue to expand service, because there is a return on our investment. So in respect to building a client pool, have you explored the opportunities of engaging other individuals to add to your client list and to kind of maximize additional revenues that may come into you? And I'm thinking, like, for example, like the Virgin Islands National Guard. They actually engage with a private provider to provide services to their membership, and they have a large membership, some federal monies. Have there been any contemplation in the discussion by which you believe that there is such entities similar to the Virgin Islands National Guard out there that you could perhaps engage and be able to start to build up additional client pool and in turn some additional revenues?
So we have been doing physicals for members of the National Guard. We are approved by CHOICE, which is I guess a national certification for providers to provide services to the military and reserve members. The members have a choice whether it's us or, other options or other choice providers. Quite a few members do come to us for their not only annual physicals, but just their regular health care, and bring their family members as well. We used to do physicals for government entities like waste management or the fire services. In recent years, they have opted to go to another provider to have that done, but it is a service that we do provide.
And you see, is there anything that prevents you from engaging even the private industry? Maybe a buyer or any other private industry? Is there anything in your charter that will prevent that from occurring?
That will prevent us from, sorry?
From engaging them in terms of providing physicals or any other examination that they require for a cost?
Right. No, there is nothing that would prohibit us from providing services to any agency or any organization. We've done it before, and yeah.
Okay. So there's an avenue there to build some additional revenues by having that type of discussion, or maybe seeking to be able to have that. What is your waiting list right now for dental?
Dental continues to be a major challenge for us. We are the only safety net dental provider. I've shared before that a patient who has Medicaid or a patient who is uninsured generally only has 3 options within our community, because we don't have freedom of choice for our Medicaid system. On the mainland, if one had Medicaid, they could go to any office and receive services. It doesn't work like that here. Here, with Medicaid, it basically limits you to the Department of Health to misusing the hospital or to Frederiksted Healthcare. With medical, the patient has Department of Health or the emergency room, and we're not encouraging that. As I said, it is a misuse, but it is an option. When it comes to dental, Department of Health doesn't offer dental, nor does the hospital. So all of the patients on St. Croix, I want to think it's about 18,000 people on St. Croix that have MAP, the only choice they can get a dental visit is with FHC. We only have 14 chairs. It's just really a challenge. We cannot serve the 18,000 people that are on Medicaid that need.
So what's the waiting list? What's the number look like?
It's in the thousands. It's in the thousands, and it's just embarrassing to come and say.
Okay, we'll stay away from that then. We certainly don't want to create any more embarrassment. Mr. Chair, if I could just engage a couple more. So in respect to, so dental is one thing. What about other health needs? Do you have a long waiting
Behavioral
list?
health is another one. Behavioral health and substance abuse. Our community as a whole, that is extremely limited, whether you have money or not. There are very, very few providers for behavioral health.
And some have money and they ain't utilizing it. So that's where I'm going, because if there's a better opportunity for us to put some of that money for immediate use, then I want to redirect some of the funds that we have sent elsewhere to start to address that, because we continue to lump money at top of money to the Department of Health. I'm not ashamed. They fall under my purview. I'm not ashamed to say that. And we still have not seen the level of aggression to address our behavioral health issue. So if we have to redirect that funding, then certainly we want to do that, because we continue to see fallout every single day. We walk the street, we see new people on the streets. We bought a mobile van, been here since February, and has not been deployed, has not been moved. Individuals have not been trained. I don't know what's going on with it. But the Department of Health will be coming before us in the short order, and we'll find out what's going on there. But how, I'm saying that we have the funding, we have the resources, the equipment, and we still are not addressing the needs. We saw it after the storms, and I'm on my soapbox, but we saw it after the storms, and after the pandemic, we continue to see the numbers increase day in, day out. They are our brothers and sisters. They are our family members. They are professionals in this community that have served their time. And for one reason or the other, I mean, they're on the dark side right now, and we're not providing the support to them. And it's unfortunate, and it really breaks my heart. Do you have any liabilities or judgment against the FHT at this time?
At present, there are two litigations. That's where you're speaking to litigations?
Yes.
There are two in preliminary stages. We've been served, and we are waiting for their outcome. We've sent all of the information to FTCA. I shared with you. We have a federal torts claim, and we are waiting for, it's in the preliminary stages. Both of them, we got notifications earlier this year.
What about this budget give you reason for pause? What about this budget? And I know that you have already put on record your spiel in terms of what you believe is due to FHC that you have not received in the past. But what about this current budget makeup outside of the variation of numbers between the other similar entities? What about this budget, again, give you reason for pause? What keeps you up at night about this budget?
As I shared earlier, we've been at this 2,150,000, it seems like, for eons. And when we come every year, we share what we're doing, we share the need in the community. We get a lot of accolades, and we appreciate it. We thank you for that. But then at the end of the day, when the budget is passed, it's been this 2,150,000. Like, so, you feel like we're doing. And I don't know if people or if our leaders or senators walk away thinking that Frederiksted is doing so good they don't need any money. I want you to know that's far from the case. I think that might be a misnomer or a belief, and even with the executive branch, they see us opening facilities and feel like they must be doing well, that we don't have to support them. What we're doing is to help provide care to the community, to the people that we need, that the people that live here. We're not opening them I mean, there's a need, and we're trying to fill the gaps, and we should be supported in filling the gaps. And, I don't know, I just don't want people walking away thinking that they're making money, so they don't need our help. When we open these facilities, there are expenses that are tied to them, their salaries, there's equipment, there's supplies, it's not, we're making all this money and the money sitting there on the bank. There's money being spent, and we are serving the community. So we need support in helping to serve the community.
Thank you very much. I'm not a member of this committee, but I'll certainly do what I can to assist in continue to drive home that message that, in fact, HC put their money to good use, and the more they get is the more that they will be able to serve. Thank you very much for your testimony.
Thank you so much, Senator Francis. Senator Blyden.
Thank you, Mr. Chair. Ms. Webster, I know last budget cycle, for your fiscal year 21 goals, you had 5 goals. The first one was to renovate and open dental site at Sunshine Mall, to implement a dental mobile van, and you spoke to the challenges you're having with dental care, to expand behavioral health services, to improve childhood vaccine, and to expand patients' access. Which one of those goals have you completed? I know you have completed a couple based on the testimony, but can you let us know?
Most definitely expanding patient access. The new site at the Sunshine Mall definitely expands patient access. The dental suite at Sunshine Mall, we are renovating it. I had hoped that we would have been open. It's not open as yet. We were able to get the medical side open, and we didn't wait. We figured we'd open medical and we'll add dental as, once we're finished with the project. The van has been a problem nationally. The problem with the van, last year we were here, we shared that we had ordered a van, and then when COVID hit, there was a problem throughout the nation in regards to securing chips, particularly for vehicles, particularly trucks and major vehicles like vans, and other parts, as a lot of the factories closed during COVID. So it's still in production, but we expect to have the van later this year. The end of this year, we're hoping.
And the dental suite in Sunshine Mall, what's the price tag for that in terms of how much have you spent, or how much you anticipate spending at the end of the day?
The equipment and supplies was already close to $300,000 in terms of the equipment. The renovations, I think, are projected at about $200,000, give or take.
And you also spoke to some of your accomplishments in 2021. The Paycheck Protection Program, the grant, in grant forgiveness, how much did you receive? How much was that amount?
PPE?
Yes.
The PPE, it actually was a loan, but it was $1,071,000. It was $1,271,000. And we did qualify for loan forgiveness. And
Okay. So the CDC grant, the 2102, what was that amount?
that is a new grant that basically will continue the work we were doing with 1502. We had a grant that we got from CDC in 2015 that was supposed to cover 5 years. They did an extension, so we had a 6th year on it, but it has sunset. Actually, today is the sunset of it, June the 30th. They had a new grant out that requests, or requests that we continue similar work as what we were doing with 1502, and that grant we have acquired, and it begins funding tomorrow, July 1st.
Great. And what the purpose, the intended purpose of it?
The intended purpose is to provide education, prevention, and treatment in the fight against HIV and AIDS.
And the 2 generators, how much was paid for those generators?
That was
$250,000 for 2.
So 125 each?
Yes.
Finally, before my time expired, because you have accomplished a lot in 2021, I want to congratulate you for that and commend you. You also spoke to COVID-19 testing services and vaccine provider. You're doing both. What have those numbers look like at the clinic?
I should have prepared that. I can get back to you. But we test every day and we vaccinate every day, but I neglected to ask them for a total number.
Okay, very well. Well, thank you again to you and your team for what you do, and I want to thank you for your responses, and thank you, Mr. Chair, for the time.
Thank you, Senator Blyden. Are you going to be reopening the school-based health clinic?
Yes, one school is back up, yes, for sure.
Okay. And how many patient visits you had this fiscal year? You charting? I know you were way up there at one point. Are you open virtually? Are you open in person? Or are you still virtual?
At our normal sites, our sites, we never closed. We've always been open.
I thought you were doing virtual.
No, well, we encouraged virtual and we've expanded, but the majority of the patients come in person. But
Okay.
there are some that are doing it virtually.
Okay, have you seen a decline in numbers? Are the numbers remain the same or an increase?
We saw a decline in 2020 as opposed to 2019. 2021, a few more coming out, but I still don't know that it'll be as high as 2019. As you know, 2021, we've still been high in COVID. But it is, the lobbies are always filled.
Okay. Are we current with all our vendor payments?
Yes.
Under Department of Health or Human Services, have they made available any of the monies earmarked for homelessness?
No.
Okay. I know I'm going to look back at the particular, and I think it's the American Rescue Plan or the second plan. I did see a section where there's a carve out for homelessness or mental health or expanding living assisted facilities, and I don't want those monies to go back. I'm trying to remember which presentation we had that I just saw it, and it had to be Miss Williams actually was here. I'm going to look for it because there are monies for expansion of homelessness, and I know that you at one point you had the little, what do you call it? It's not a refrigerator, but it's a...
Right, the refrigerator. Grace, she, I guess, has sunset. We're trying to replace her. But yes, we had
that was a very good initiative.
Right.
You want to say what you were doing? Because that was really a nice initiative.
We had a refrigerator on our porch in Ingeborg Nesbitt in Frederiksted, where we had partnered with several restaurants and even the public schools for any leftover food. We would place in the refrigerator, and anyone could take food from the refrigerator. Since the refrigerator has not been working, we've been actually making brown bags that we're putting sandwiches in, granola bars, apples, fruits, and so forth. And as people need, they come and we give it to them from the site.
So you need a refrigerator?
We do need a refrigerator,
But
yes.
with that clear glass, it was like...
right.
What's the cost of it?
That one was donated by Coca-Cola. So I don't know the cost.
Coca-Cola ain't ready to donate the next one?
They know it's not working. We've shared that with them.
Okay, I think that was the food being taken by individuals throughout the town? Would it be empty the next day?
Oh yes, yes it would.
Regular?
Yes. In no yes.
Okay.
Yes.
And then you had the books were there also? You had a book?
We still have that.
You still have the books?
Yes, we have a book library. That actually is in collaboration with the Community Foundation of the Virgin Islands and...
Are they replenishing the books on a regular basis?
No, the community replenishes the book. They started it with books, and then you take a book, you bring a book, you take a book, you bring a book. So people are always bringing books.
Okay, and it's being used?
Yes, definitely. It definitely
I think it's a nice initiative too. I did donate some books to that. I didn't know it was bring and take.
Yes.
Okay.
Yeah. But nobody's there like standing guard to make sure you put back a book.
Right.
But it's nice if you bring a book.
Okay. Senator James, your audit's up to date, right, Mr. Irma?
Audits, yes. We're actually in the middle of an audit right now for fiscal year 2020.
2020, okay.
And with our budget requests that we submit to OMB, we always include our audits.
Got it, okay. Ms. Proud does such a good presentation every year. By the time she's finished with her presentation, everybody's like, oh my God. Give her $10 million. You gotta be careful. You gotta be careful because she's so convincing. You gotta always process everything because when she's on target, she's on target. Senator James.
Question: when it comes to the delivery of the mobile van, you said that you're expecting it this year. You have any time frame of when you're expecting it?
We have been back and forth with the vendor on this. I have seen it on the news, so I do know it's true that they have been having challenges with getting equipment and supplies, particularly for trucks and big vehicles. Many of the factories were closed because of COVID, and they couldn't find equipment. And then there's
quick question: when we get that vehicle into the territory, right? Do you know for sure that we have an what do you call it? One of those individuals to service the vehicle and maintain it, like whether it be Toyota, Ford? You already have that in place?
Yes. It's a Ford transmission. It's a Ford engine. Yes, Ford will be able to repair it.
And you have the means and the funds to take care of that, and is it factored into this budget?
Yes.
Okay, I just want to make sure, looking down the road, that you have the tools that are necessary, because when it comes to the mobile van, I really appreciate you all going up and beyond to make sure that the most vulnerable and hard to reach patients are being taken care of. And I see here where you have mentioned about the National Health Service Corp site designation, and that is brilliant. And I'm not sure if that is implemented in other areas within the health institution as far as JFL and the Snyder Regional Medical Center. But I see here that it allows for providers to apply for student loan repayment in exchange for working at a National Health Service Corp site. How many individuals were able to take advantage of that recruitment tool?
Right now, we have 3 of our providers that are participating in it. Any of them can apply, but generally in any given year, it's usually about 3.
And this is something that you just embarked on? Or
No, we've been at NHSC site. I met it in place.
And ever since the implementation of this recruiting tool, how many individuals benefited from that?
If we said 2 a year, I've been there 13 years, that would be 26, give or take.
Okay, I just want to place on the record that's a brilliant idea. And as far as you mentioned that you have a plan to carefully manage your resources and stretch each dollar spent. It's very sad when it comes to health providers having to place those things on the record, but I do understand that you're conservative. But can you elaborate some more as far as what things you're putting in place to make sure that if we do see a change in our revenue collections based on what's going on in the territory, how will you be able to sustain?
So most of our salaries, our employees are on the local budget or on our federal grants. We really try to keep our operating expenses to be paid through program income. Because these awards has remained the same, we've now had that employees are being paid on program income. So for the most part, our salaries are secured because we definitely get our federal grants and awards. So with the downturn, because 2020 with COVID definitely affected us, we just kind of slowed back on what we were able to purchase and stuff as far as replacing equipment, computers, or whatever in that year. But the federal government, by the end of the year, have definitely supplied us with some one-time fundings and this Rescue Act grant as well. And now there's a capital improvement grant that we also got. So there's couple funding that came through that allowed us to, again, fast forward and be able to invest and upgrade our equipments, and we're going to be able to do some capital improvements and stuff like that in this year.
Time.
And last but not least, when it comes to our military veterans, do you find yourself catering to a lot of the military veterans? Do you have a database? Is there a collaboration with the Office of Veteran Affairs to make sure that our veterans are being taken care of? Is there a program in place? No?
We are certified through Choice. Choice is the military, I guess, credentialing office for providers to active as well as reservists and veterans. I think they then send the notifications out to the VA office. We haven't done that personally, but I have had discussions with Director Farrell, so I know he's aware. And I was sharing earlier with Senator Francis that members of the VI National Guard do utilize us for services. Logistics Health has a contract, and they've subcontracted us to provide healthcare services to our National Guard members, active duty and reservists.
My time was called. You're doing a lot. And when I say you're doing a lot, I'm speaking about your entire team. But please, next time, place those things on the record, toot your own horn a little bit, and make sure that at the end of the day, we're catering to every sector in this community, especially our veterans. Thank you, Mr. Chair, for the time.
Thank you, Senator James. Senator Francis, you had any more questions?
Just real quickly, who have you been in touch with regarding the presumptive eligibility? Who you having a discussion with?
We've had meetings with the director, Mr. Smith.
Mr. Gary Smith?
Yes.
Okay, good. Yeah. What is your collaboration between FHC and the Department of Health and hospitals? Do you have a round table? Do you engage frequently to just have this healthcare discussion in general?
Since COVID, there are the COVID meetings. Outside of the COVID meetings, the answer would be no.
Don't you see the need for some collaboration, some fraternity that really speaks the health issues, especially in the light of what we're up against here in the Virgin Islands as it pertains to healthcare? I think all of the stakeholders, at least at that level, should be engaging. Don't you?
Yes, I agree with you.
Very well. I'll try to facilitate a discussion like that. Do you believe that all of your sites now, you have 6 sites throughout the island, do you believe that that's sufficient in terms of being able to capture those that may be in need, or do you believe that there is some additional location that you need to be able to deploy to be able to capture some additional person within those areas, those geographic areas?
Right now today, or the rest of this year, I would say, our team is not looking at expanding right now, but I would say I am concerned about between Sunny Isles and the Mall of St. Croix. Mall of St. Croix, most people know as Sunshine Mall. I think there's a big gap from Sunny Isles, where the last medical office that I'm aware of exists. There's no offices west of Sunny Isles until you get to our site, Lena Schultebrand, in Mall of St. Croix, right? I think there's a big gap there, and there are a lot of neighborhoods there. You have Strawberry, you have Montbijou, you have Clifton Hill, you got Grove Place, and
Lorraine
a
Village,
lot of the
Croyville,
people live in those areas are within, your lower economic, $25,000, and under, give or take. So I think there's a big cluster right there. Ideally, when we were looking at a site, we were thinking further east than Mall of Sunshine, Mall of St. Croix. However, there was an office there that had been vacated, and it was easier to rehab. There was no health facility available. But I really think that's a gap, and that's something that should be addressed. And whether it's us or somebody else, I don't see us doing it in 21. But at some point, there is a big gap. That is a major area.
Very well. Thank you. Thank you for your response. Thank you, Mr. Chair, for the time.
Thank you so much, Senator Francis. Senator James.
Thank you, Mr. Chair. Just on constructive criticism, I'm on the Facebook page, and I am seeing here the last time something was posted was February 4 hours ago. And that was the meeting we had on May 25th with the body, or my colleagues. And then after that was January 8th, and then December 22nd, 2020. and then December 1st, 2020. Out of all the great things you're doing, who is your public relations officer? Who is relaying that message to the public to let individuals know of the services being provided, the expansion, the growth, and even the need for us to even increase the budget?
It's something that we've toyed with. We do not have a public relations officer. It's been something that has been talked about, discussed. For me, I've always felt, and I see the need, but I fight between, do I hire another nurse or two, or do I hire a public relations officer person? And it comes down to, let's hire a nurse or a couple of nurses, and most of what's done as far as PR actually comes right out of my office. Press releases I usually write and send them to the media. And then between myself and other managers, we put posts up now and again when we get the time. But we really do not have a dedicated person whose sole job is to do PR for the agency.
So can I make a suggestion, even if it's on a part-time basis?
But I
or on a
want to
contractual
add,
basis?
our IT department definitely does maintain our website, and they try and update it with, current activities that's happening from day to day. I'm not sure if they manage the Facebook page as well, but I know that they definitely have been managing and updating our website.
Please do, especially when we get that mobile van. It's going to be necessary for us to have that social media platform so individuals can know how to get access to these services that are being provided, okay? Thank you, Mr. Chair, for the time.
Thank you so much. What are you going to be using a mobile van for?
To go out and provide both medical and dental services to, the remote parts where many of our people in the community live.
So you're going to have to ramp up staffing?
Yes.
What's the staffing budget for the van? You have a projected amount?
I don't think we have that as yet, but we know for sure, because we were going to use our current staff that we had at this time. We were expecting it to be here already, so we were going to use our dental team to go out to the schools and the other schools that we have. But now that we have this year to look at it, we can look at additional staffing for medical and dental. So it'll be a dentist, 2 assistants, a driver, a provider, a nurse aide. So it's simple that we can either use our staffing, and if it's going to be on the road every day, then we know those are the staffing we would need for the van. So that's easy to come up with. It's a matter of where we fund it from, or whether we're creative and just use the current staff that we have.
Can you provide me with a budget for funding the van? You say you're going to be doing schools also?
Yeah.
So
Our target is, so our school is,
then like a public health initiative?
Yeah, because the numbers that we're looking for sure for dental is we really need to get to the elementary schools to get them in there for the, we call that where they do the cleanings and the caps and all of that for the kids. And so where we at right now with the teens, we're really not getting the numbers that we need that the federal government is looking for. So to get into those schools, they don't have that readily available health center within the schools as the complex had. So we definitely want to have a van that we can go to the schools and not have to have them be taken out of their classes.
And that's an excellent initiative. Recently I was just thinking about what used to happen when I was younger and what happens now.
Right?
And there's such a disparity. We have just fallen so far behind in terms of what we used to do as a community. And I remember those public health nurses coming to the school for that dental visit. You didn't have a choice. I remember them coming for vaccination. You didn't have a choice. You line up and they bam. They used to come for vision, and then they send a referral home to your parents saying that this person needs glasses. And those are basic stuff that took place on a regular basis that are now non-existent. And they are non-existent despite the fact that our budgets have grown tremendously. And the amount of individuals we have working has grown tremendously. But yet the basic services that we're supposed to have are lacking. And this is not for you guys, just a little tangent. And the reason why that happened is because we have gotten into a mode of just hiring individuals in management position. So everybody wants to come to government, but everybody wants to be a manager. And nobody wants to provide basic services. So you have 9, 10 managers, deputy commissioner, assistant commissioner, but you don't have that public health program that existed. So Frederiksted now trying to fill the void because you already inherited the dental program from the shutdown at Charles Howard, and now you're trying to fill the additional void. So it would be the responsibility, I think, of the GVI, if you're going to fill that public health void that is lacking, that the least we could do is provide the staffing. So I think that we need to look at that particular direction. I know Senator James, you spoke about that loan forgiveness program that they have instituted. That is in education, it is in healthcare. Those are options that our students need to know. Once you come back and you provide a service in healthcare or you provide a service in education, you serve a certain amount of population that are disadvantaged, you qualify for the loan forgiveness. And I'm glad that you said it on the record because there are many educators that don't even know. And they don't apply for it because it's not pushed. So I thank you for that. You can provide a budget for me at maybe a week, 2 weeks, okay, so we can have it and we can see what direction we are going to be going. Is it one of the big vans that you're purchasing or a small one?
I think Department of Health has the same.
It's a mil-
They have two, right? I think
They have,
the same
no,
two.
they,
They have a smaller one.
They're both long.
they have what now,
We
Senator
went to one
Francis?
at
3
the
vans?
Ag Fair. It was
Department
small
of
like
Health?
that.
St.
Oh, wasn't
Croix? How
there?
many vans they have parked up?
They have
They're like-
them are long.
We have
They
4
are
vans
long.
parked up now, Ms. Rowe.
It's not as big as that.
We have 4.
Four, okay. There was
Three-
one when we worked
3 big
alongside them
ones.
at the Ag Fair. It's a single room. It's the waiting area and then one exam room on the bus.
Okay.
On the van.
But wonderful initiative. We're going to look at the numbers for the budget. We're going to get some information from Office of Management and Budget. You send us additional information, and then we'll be in contact with you, and we'll go from there. This where I'm going to allow you. I'm going to look and see if I can find. I was looking for it. It was an Excel spreadsheet with Department of Human Services, and we got a committee of the whole. I was looking for it because it's a language that referenced homelessness and the grant amount. I think it was like 200 or something thousand, but barely any of the monies were spent, if I remember correctly. So if I can find it, I will let you know. But I'm going to allow you to go ahead and put a closing statement on the record.
We would like to take this opportunity I'd like to again thank the staff of Frederiksted Healthcare for their commitment and dedication to the community of St. Croix. I'll take the opportunity to thank our board of directors for their support and their vision in all that we do for the community of St. Croix. And of course, I want to thank our patients and the community for their support and trust in us for their health care for themselves and their loved ones. And I thank you, senators, here today for your time in listening to us to allow us to share our successes and our challenges. I thank you for your ongoing support. I definitely hope that it is an error as you think that it may be. And if it is not an error, I again will ask you to definitely make sure you lobby for parity when you go to your budget markup or markdown. And we thank you for all that you do for our community as well. Thank you.
We thank you so much, colleagues. We have an early end time today. We'll be back here tomorrow with Sports Park and Recreation, the Olympic Committee, and put it on the record. What's the last one, Madam Clerk?
The Office of the Adjutant General.
Okay, great. So thank you so much. Colleagues, I want to thank you, my staff, media, all employees of the legislature, Senator James, Senator Francis, you hang out with me this afternoon, so I thank you for being here until the end. It looks like Mr. Noja back there. The Committee on Finance is hereby adjourned.